All right, good afternoon, everybody. This is our December 10th, 2020 meeting of the General Policy Committee, our last General Policy Committee meeting of this calendar year. And so our first order of business is adoption of the agenda. And I think a couple of commissioners wanted to discuss, order and items on the agenda at adoption. So let's go ahead and start with Commissioner Simmons.
Mayor, I wanted to discuss maybe moving item number 200560 first. And the reason being is that we have a large group of folks that's going to be presenting from various folks from the University of Florida, and they're on their break, and I would like for them to get in and have a conversation with us and go back to work.
Okay, that's fine. I know for the first item too, we've got some folks from Washington that are voting in for that.
And the second one.
Yeah, and I spoke with the city manager about that, and he was okay if we switched them around.
Okay, they'd be available later?
Yeah, he was okay with that.
Okay, Commissioner Ward?
Thank you, Mr. Mayor. This is a really packed agenda, and I want me to be fresh when we talk about the disadvantaged worker and apprenticeship ordinances. So as much as I really want to get those done, I would prefer we move those to another meeting, because if we have the kind of discussion that I hope we have on those first three items, we're not going to make great decisions on the last two. So I would like to put it off. I talked to the manager and the clerk about that yesterday. So.
Okay, and typically our first GPC meeting of the quarter is mainly an organizational meeting and setting the agenda for the rest of them. So there should be time on that agenda for those two items without worrying about, getting lost with a bunch of others. So if you wanted to move them to the first meeting in January, I think that would probably.
We don't need a motion for that, do we?
What's that?
We don't need a motion for that, do we?
Well, we'll get a motion to adopt the agenda and
okay.
do everything.
Yeah, I mean,
okay, I think it's Commissioner Johnson, right?
Yeah, it is. Yeah, thanks. I would actually prefer if we left the economic outlook and First Community CDC second, because we also have someone that's presenting from First Community CDC, and she's here, and Carla Miles is here from that organization. So there are folks presenting for that one also.
Okay, Mr. Manager, are you? Do you hear me?
Yes, sir.
Can you let our federal lobbyist folks know that they're going to be third on the agenda, and I don't know, maybe that will be around between 3 and 4 o'clock?
We'll do that, sir.
Okay, thank you very much. So what I'm hearing is an agenda that would include Commissioner Simmons' item first, the economic outlook second, and the Florida legislative priorities third. I'm sorry, the federal legislative priorities third, and then continuing the disadvantaged worker ordinance and the apprenticeship ordinance to our first meeting in January. Is that good with everybody? Okay, is there a motion to that effect? Okay, is there a second? Okay, motion by Commissioner Ward, second by Commissioner Simmons to adopt the agenda with the modifications that we put Commissioner Simmons' items first, economic outlook stays at second, Florida federal legislative agenda third, and continuing the last two items to our first meeting in January. All in favor of the motion say aye. Aye. All opposed? That motion passes unanimously. Okay, so then back to our agenda. We do not have any minutes for approval this meeting, and so we will turn it right over to you, Commissioner Simmons. I'm sorry, Commissioner Johnson, before we...
Really quickly, I think there's additional backup that I'd like to request that the backup be added and republished for the public and for us.
For,
For the economic outlook and First Community CDC.
okay, and that came from you?
No, it came from me, through me, yeah.
Okay. So Madam Clerk, if you heard that, Commissioner Johnson, it sounds like submitted some or passed along some additional backup, if that could be uploaded to the item for folks to be able to see. I think we got a hard copy. Is that the same thing?
No, something different.
Something different?
Yeah.
Okay. Okay,
She's familiar.
we'll try to get that uploaded before the items comes up.
Thanks.
Okay, Commissioner Simmons, over to you.
Thank you, Mayor. Thank you, my fellow commissioners. I want to start off by saying that the Gainesville Health Access and Equity Advisory Group was convened in early 2020. And I would like to list the members of that group. Dr. Adrian Tyndall, he's the interim dean at the University College of Medicine. Dr. Linda Kotler, who's the associate dean for research at University College of Medicine. Dr. Carrie Bush, the chief of staff to the chief operating officer at the University of Florida. Wendy Resnick, the senior director of finance with UF Health. Andrew Tellis, the director of collaborative initiatives with the University of Florida. Dr. Jody Long, Associate Vice President for Academic Affairs, Health Sciences at Santa Fe College. Dr. Rita Resnick-Lutz, Academic Chair of Nursing at the Santa Fe College, and this is under the direction of Dr. Paul Brody, the President of Santa Fe College. Dr. Stephen Yuck, the CEO of Emergency Physicians Medical Center. Catherine Patmore, Practice Administrator, Emergency Physicians Medical Center. Barzella Papa, President and CEO of the Community Foundation of North Central Florida. David Roundtree, the Director of Diversity and Inclusion Outreach, the Community Foundation of North Central Florida. Deborah Bowie, the Assistant City Manager with the City of Gainesville. Tanisha Marshall, the Equal Opportunity Director with the Office of Equity and Inclusion with the City of Gainesville. Zariah Folston, the Policy Oversight Administrator with the City of Gainesville, and Ariella Bach, the CRP Program Coordinator with the City of Gainesville. The Health Access and Health Equity Committee was created, like I just stated. The Alachua County healthcare providers, such as the Department of Health, University of Florida, the community organizations that I just briefly mentioned, regularly perform health care needs assessment every few years that identify areas for improvement within the county. And East Gainesville is often has been identified as an area of concerns in these assessments and improvement plans. However, little seems to change. Poverty and poor health outcomes persist in Eastside zip code. The pandemic has shed light on issues related to community resilience as access issues prove more desperate for minority communities. Recently, COVID-19 has again highlighted the many health disparities in our local African American communities. The Health Access and Equity Advisory Group recognizes that these disparities have been made worse by a lack of access to healthcare, and today we'd like to share some existing data with you as well as some other data from recent health equity and access surveys that we did. So at this time, we're going to begin the presentation, and we're going to start out with Assistant City Manager Deborah Boyd. Thank you, Ms.
Okay,
Boyd.
thank you so much, Commissioner. And if you could go to slide number 3. There you go, perfect. So I'm going to walk you through a few slides. Let me set it up. So she mentioned, Commissioner Simmons mentioned the zip codes. Zip codes are routinely used in health assessments to identify areas of focus. So today the discussion is going to focus on zip codes that are east of Main Street. You see that star in the middle of the page. And so those zip codes are 32609 and 32641. Both of these zip codes, of course, do not end at the city limits, and they overlap with portions of unincorporated Alachua County. So you see from the stars, we're going to be focusing on those two areas, and there are some notable markers there. So 32609, Walmart, the airport, Howard Bishop, and then you see in zip code 32641, the health department and East Side High. So next slide, please. So before we get to the next slides, you could take the next slide. I'm sorry, the advanced one. There you go. To number 4, thank you. So before we get into the next 4 slides, I want to back up a little bit because it's important to kind of lay the table a bit. So the next 4 slides are going to highlight the findings from the 2020 Alachua Community Health Assessment, but back up about 10 years or so when people in this community began to really understand the nexus between data and heat maps that connected disparities in health access, unplanned pregnancies, and childhood trauma. In fact, many might remember this work from Dr. Nancy Hart of UF when she overlaid her maps with maps from the Alachua County Sheriff's Office in an area that we all commonly refer to today as SWAG. What they found in that area is that various hotspots where they found an abundance of unplanned pregnancies and cases of childhood trauma, a lack of medical services, were also areas that overlapped with high rates of crime, and particularly in areas of concentrated poverty. So from there, we all know the history. The mobile clinic on wheels was formed in the way of a bus. And then eventually what was established there was the Southwest Advocacy Group Resource Center, and then of course a brick and mortar clinic. What's worth noting is that over the years, data and analysis has improved, right? And so we know, for example, that the Robert Wood Johnson Foundation has found that people who are living in just a few blocks of each other could have completely different opportunities to live a long life, in part because of their neighborhood. If you're interested beyond today's discussion and taking a deeper dive into that, visit the Woods Foundation. They have a free zip code calculator online, and it will show you the latest life expectancy by zip code. It's worth noting that if you back up 10 years or so, when Dr. Hart first started this work, she identified these 2 zip codes, 32641 and 32609, as the most in need of health improvement. So since her work, right, we said then and now, what's happened? Well, not a lot. These zip codes are still areas where residents continue to experience poor health. That means they have included, it includes high rates of costly inpatient admissions, emergency room visits for medical conditions, as well as dental and mental health needs. So advance to the next slides, please, the next one. The recent maps from the 2020 assessment show the most recent data available. And I said not much has changed. So let's start with this one. So the first thing you see is the title that says avoidable discharges by zip code. And so let me tell you what that is before I talk about it a little further. Avoidable discharge is simply, it's a model that estimates the types of hospitalizations that are avoidable for the patient, So for example, a diabetic patient who is getting care and is compliant would not normally be admitted for diabetes, right? But if they are not getting care, or let's say they're not compliant, they're not taking their meds, they're not self-monitoring, they would have to be admitted. The same would be true for patients who have asthma, hypertension, severe dental issues. So if you look at this, you see the intense green, forest green, 32609, zip code 32641, shows the highest concentration per 1,000 residents in the rates of avoidable discharges. Next slide. So we see in the next slide, the same trend continues. This is emergency department visits by zip code. Again, same 2 zip codes. You see that concentration. Next slide. Same thing with oral health visits by zip code. Again, those 2 zip codes, you see an over-indexing in those areas. And then the final slide, the next one that we're highlighting from the 2020 Community Health Assessment, this one is on mental health. Again, what do we see? We see a pattern, again, of a higher concentration in those 2 zip codes.
Ms. Bowie, thank you. If you could please pause for a question, Commissioner Ward.
Thank you, Mr. Mayor. Ms. Bowie, the emergency department visit rates by zip code and oral health and mental health. I mean, we all know, I think, where these are, but I wanted to highlight too, it looks like there's the same rates sort of downtown and not in a full zip code, or is that just a stray mark that ended up there? I think that's the case.
Right. So if you remember back to even when Dr. Hart had done her research, her seminal work about 10 years ago, again, so when you look at these overlay of the areas, you see these concentrations. This doesn't imply that these are the only areas. There are pockets right throughout. But I think what these selected zip code maps show you is that there is a much higher concentration in these two zip codes. For sure.
Absolutely. I was noting the darker space,
Sure.
the matching space right in the middle on some of these, and that's not by full zip code.
Sure.
I'm good. I just wanted to see if there was something special about that area that was.
No, not, keep in mind, these are slides from the full report.
Gotcha.
And so yeah, so we can certainly provide you with the full presentation.
All right, thank you.
Yeah, thank you. Commissioner, back to you unless there were other questions. And I think it's because we have so many people here, it may be best, Mayor, if there are a number of questions, we can certainly all be available at the end of the presentation and people can speak specifically to areas that they have an expertise in.
Mr. Simmons?
Thank you, Deborah. So we have had many conversations about public participation. The goal of equitable public participation is to center the perspectives of people facing the greatest level of racial disparities. We cannot make decisions without the people in these communities. Next slide. The Health Equity and Access Advisory Group understands the urgency of bringing gaps in care and bringing resources to areas impacted by these disparities. While the maps share how the disparities manifest, example, high ED visits, low health outcomes, they do not reveal the root causes or give the community members a voice in the solution. Thus, this advisory group created a survey to provide community members with an opportunity to speak to the problem. The engagement process took a unified effort from a myriad of departments and community-based agencies. And as we move forward in the next couple of slides, we're going to have Dr. Linda Kotler explain to you these slides. But before she does that, I wanted to introduce her. Dr. Linda Carter, PhD, is an Associate Dean for Research at the College of Public Health and Health Professions and Dean's Professor of Epidemiology at the College of Public Health and Health Professions and the College of Medicine at the University of Florida. Dr. Kotler's research has also focused on populations underrepresented in the research enterprise to increase health equity. She is founding director of Health Street, a community engagement program of the UFCTSA in which community health workers assess health concerns and needs of community members and provide referrals to medical and social services and opportunities to participate in research. Dr. Kotler is the director of the community engagement for the University of Florida Clinic and Transitional Science Institute. She also serves on the board of directors of the Association for Clinical and Transitional Science and is the co-chair of the Special Interest Group, PACER, P-A-C-E-R, for Partners for the Advancement of Community Engaged Research. Dr. Kotler has published over 320 manuscripts and chapters and has been the recipient of numerous awards for her mentoring and research achievements. Dr. Kotler, welcome and thank you.
Thank you so much, Commissioner Simmons. Could I have the next slide, please? So I would like to thank all of those who are here, and I'd like to thank all of those who participated collecting these data. And what we're going to show here is that for 3 weeks, the people were out into the community and they were going all around and they were asking people the survey of about 10 questions. And when you overlay these data on those that you've seen before and some other data that have been collected in this community, you can see that there is a replication of concerns and needs of this community. So over 3 weeks, there were over 1,000 participants who completed the survey. And this was an open community invitation. It was not a randomly selected population. But nonetheless, 1,025 people participated. And if you look at the graph on the left, it looks at the age group of the participants. And you can see that we had a preponderance of people who were between 40 and 64 years of age. You can see we had quite a number of people who were over 65. And we also had quite a number of people who were 25 to 39 years of age. And you can see in the blue bar, that's the 09. You can see in the orange bar, that's 41. And in the gray, those are all the other zip codes. And this is the way these graphs are going to be shown throughout. The graph on the right shows the gender. So a very high proportion of the participants were female, which is kind of par for the course with some surveys. And then what you see here is a survey that is a preponderance of females who are around 40 to 64 years of age, who are probably also giving you the perspective of people in their families. Next slide. The question was, have you visited a healthcare provider in the past 12 months? So as you can see, almost 100% of the people in 09 said yes. 88% in 41 said yes, and 78% in other zip codes. However, what's the reason for this high rate of saying yes? And it could be that many people in other zip codes are going for annual checkups, whereas people perhaps in the 09 and 41 zip codes are going because of the comorbidities they have. That is, having more than one disorder. And this could be comorbid disorders like hypertension, diabetes, which often occur together. Next slide. So when we asked them, if you had a medical provider that you see at least once a year, how far do you travel to see that doctor? So while a high proportion of people said yes, they've seen a provider from the previous slide, we can see here now that really the people in 09, in the 41 and 09 zip codes really have to travel at a much farther rate than others. Twice as likely for people from these two zip codes as people from other zip codes to go more than 5 miles, which is also a concern. And other surveys have shown that these households are transportation disadvantaged, and that maybe working respondents may use urgent care or other after-hour options, and that's due to conflicts. And those urgent care and emergency departments are more than 5 miles from those zip codes. Next slide, please. When we ask them outside of the hours of 8 a.m. and 5 p.m. or on the weekends, what do you do in an emergency or urgent need? For example, if you broke a bone or you have chest pain. So overall, everyone says that they go to the emergency department, or that they would go to the emergency department. Over 50%, but this is higher among those in the 4109 zip code. And in those zip codes, a higher percentage of respondents would call the regular doctor, or they would tough it out at equal rates compared to others. And this is concerning, that people say that they would tough it out at the same rate that they say they could call their doctor. Next slide, please. So if you wanted mental health services, which kind of a service provider would you like to see? Everyone said that they would want to see a therapist, but the 41 and the 09 zip code respondents reported a higher rate of wanting to see a therapist. They also said that they would go to a faith leader for their mental health services, which is a substitute for a provider, a healthcare provider. They will go to their faith leader or faith community. And so is that because there isn't anyone there, that it's scarce or non-existent? We know from some data that we have collected through Health Street that there is a very high rate of depression and loneliness and stress and anxiety in this area, for which providers are scarce or non-existent. So while they would like to see therapists and they would go to their faith leader, we really do need to consider more opportunities for people to see healthcare providers in this area. And finally, when we look at the barriers on the next slide, and the obstacles to healthcare that they experience, this was a multi-part question, and respondents could select more than one answer. And frequent responses from the 0941 respondents were that it costs more money, that it's very expensive, there's a schedule conflict for work, they have a lack of transportation and a lack of insurance. Now, there were 1,025 respondents, and so we did consolidate these, but these obstacles and barriers are replicated by other data. And I just want to say one last thing, and that is this 2020 Community Health Improvement Plan, the CHIP, that will be released at the end of the calendar year for Alachua County, includes some of these very obstacles and barriers, as well as some of the data that we've collected through Health Street. So I'd like to turn it over now again to Deborah Bowie.
Thank you so much, Dr. Kotler. If I could take the next slide, please. So where are we, right? We've certainly seen that where high demand for health services meets unmet needs, we have the creation and the perpetuation of disparate health outcomes. I think we all know from this last year that on the local level, the state level, the national level, Black and brown populations are impacted at a much higher rate. Hispanics are more likely to actually get COVID, but African Americans are actually more likely to die from COVID. And what we've learned is that COVID didn't create the disparity, it just laid bare what you've heard and seen in the data, that the comorbidities have really led to a toxic stew among these populations. And so, you know, these are not unknowns in our community. We've known it for a while, and the pandemic has really sort of put it really in front of all of us to address these disparities in our community. So as a group, I think we all agree that we have sufficient data. We have a lot of data in this community, and the survey, and thanks to Dr. Ann Wolf and Shelby Taylor for working on a survey, we thought it was important with the pandemic to get additional data from the community because I think everyone's really thinking about how they use or don't use what's available, not available to them during this time of great need. But we have the data we need. So the group is asking the question, what role can the city play to support an equitable access, the building of an equitable access system for healthcare in Gainesville? And if there's concurrence that there is a role for the city to play, then how do we get started? And I turn that back over to Commissioner Simmons.
Thank you, Deborah. And so now here we are, next slide, please. Is the ask. Go back one slide, or forward one slide. Okay, maybe it's not in there. Yeah, right there, the ask. So the ask today, my fellow commissioners, is to assess the city's real estate assets, including the G-Tech building, which could be used to create a public-private partnership to expand healthcare services in East Gainesville, specifically in zip codes 32609 and 32641, to determine if existing economic development incentives within the city, county, or the opportunity zone may assist in recruiting healthcare services or providers to East Gainesville, specifically in zip codes 32609 and 32641, and to direct staff to bring back information for a pilot program, including costs to improve transportation access to healthcare services for impacted zip codes, specifically 32609 and 32641. And so at this time, this concludes our presentation. We will open it up for questions, and we do have members of the group on call, and they may want to add something before we ask questions.
Sure, yeah. Is there anybody else on the call, any of our sort of resident experts want to add anything to the conversation at this point? We do have a bunch of commissioners that want to jump in as well.
Wendy Resnick. I'm not sure if you can hear me.
We can.
Okay. I just wanted to go back to Commissioner Ward's question about the maps. That's just a mapping software glitch. It's supposed to be the whole zip code is the darkened color. So what he noted is just a technical difficulty.
Thank you. Anybody else on the call? Okay, let's turn over to the commission then, and we'll start with Commissioner Ariola.
Thank you, Mr. Mayor. Thank you to the presentation. Commissioner Simmons, your initiative is admirable. this has been a really great initiation to a very important discussion about public health and the disparities that exist in our community. To answer the question, I think there is a role for the city to play, and it really would be unprecedented. There's such a space that is left by the traditional healthcare system in the United States for cities to step into and create something new. I think that the ask that Commissioner Simmons has made is great, and Commissioner, I would be happy to second such a motion. And I'm comfortable with this because of the approach that's been taken. The first thing that we have to do is really put together the right people in the room who understand health disparity, who understand the resources in the community. There is a lot of collaboration already going on with the safety net organizations, and I've talked to a few of them, particularly Dr. Geyer with the Alachua County Safety Net Coalition, which includes a lot of the organizations that you mentioned. And really, the biggest need is to try and get more buy-in from the traditional healthcare providers like UF Health, like North Florida, and really getting them to participate more in the safety net. So where I see the city going is I see two paths. And the first thing is access to healthcare, which can only be provided by actual healthcare facilities. So actually having clinics. The lack of clinics on the east side of Gainesville directly contributes to our health disparities in our community. That's been a conversation that I've heard for many, many years now. I think that because there's a space for the cities to step into with partnerships, we can't take that step. The second thing is helping people pay for that health care and understanding that there's always going to be need for a safety net. There's always going to be need for free and charitable clinics. There's always going to be need for mobile clinics, things like that, because we don't have universal healthcare coverage in this country, people are always going to fall through the cracks, and people always need to have availability to be served in that manner. But how do we help people get healthcare coverage so that they can take preventative care and they don't have to rely on emergencies to get healthcare? And there, I think, is another opportunity for the cities to step into. And what I would like to see is, if we could add this to any motion, would be for our staff to look at how the city of Gainesville can invite businesses, local businesses, and other institutions. And we've had this conversation a little bit before about taking other institutions to take our healthcare risk pool together, which will help lower costs across the board. So what I'm talking about in this sense is the concept of a healthcare risk consortium, where the public and private institutions are able to sort of share the cost of healthcare in Gainesville, and the city of Gainesville can be sort of a conduit for that because we already purchase such a large quantity of health insurance from our provider. And the way that I see that succeeding is really by billing it as a way to lower healthcare costs throughout Alachua County. So I think by going with these two paths, we're addressing people's need to access healthcare, and we're addressing people's need to pay for that access to healthcare without having to rely specifically on social safety net, while also not neglecting the importance of supporting that social safety net. So that will conclude my comments. Again, I want to thank the commissioner and the advisory board. Really fantastic work, and I'm very encouraged by the direction today. Thank you.
Thank you, Commissioner Ward.
Thank you, Mr. Mayor. First of all, thank you, Commissioner Simmons, for bringing this forward. Assistant City Manager Bowie, thank you for coordinating, and everyone who's been involved at this point. I really appreciate what you've done. Thank you to everyone, all the 1,000+ people who completed the survey, and anyone who has been involved in the project to this point, and the discussion at this point. There's several several things that we need to discuss here, most of which have been started at least. I'll start off with following on Commissioner Ariola's comments. We voted unanimously in the summer of 2019, maybe even spring of 2019, to discuss how, or to research rather, how we might open our health insurance pool to not only improve benefits for city employees, which is something we very much need to do, but also coordinate with the school board and the county to create a bigger risk pool. The bigger the risk pool, the cheaper the insurance. That's just, and the more you can demand from the insurance, the more leverage you have to work with it. We did some work on that, but we didn't go as far as we needed to. And of course, the idea is, as you said, Commissioner Ariola, to spread that out then and open it to individuals and small businesses throughout the community who just can't afford health insurance through the regular markets. As big a step forward as the ACA, Obamacare was for us as a nation, it still leaves so many people with unaffordable insurance. So those are the folks who wait and tough it out if they have a broken foot, you know, if they have a cough that just won't go away, because they don't have insurance, and you're going to come away with thousands of dollars in bills if you go to the emergency room, and they know that, so they just don't use it. I would like to see us redouble our efforts on that. I spoke with, last summer of 19, at the time, the entire school board, the entire county commission, and I'm confident that the people, the roles that have changed on those two boards would be comfortable with it, as comfortable as the people who preceded them, because this is something that we can do that isn't going to cost us any more money, I don't think. I think we're going to save money as an organization, and they will save money as organizations by doing this. So I really hope we can redouble our efforts on this. Let me say also, before I go much further, that Commissioner Simmons, I certainly support all these asks. These are just additional asks to go with it. One of the things that I noted on the survey, the open-ended questions, let me get this back up here. Barriers to care. The frequent responses were high cost, which we just addressed, schedule conflicts, transportation, and lack of insurance. I don't know that we can do much about specific high costs, but we can certainly address transportation and lack of insurance. Turns out we manage a transit system. So there's a way. I don't know what it is, and I know that it's not going to be inexpensive. I know that it's something we'll have to work our way around, but there's a way to get people to the doctor. There simply is. We can treat it as we treat. I'm not necessarily talking about the vehicles that can get equipment on as well. That's a different story. But if somebody just needs to get to the doctor, we can treat that the way we treat first mile, last mile service. There's a way to make this work. And it's not free, but we could make it no cost to the people who need it. And it's the benefit to the community is that a healthy citizen is a productive citizen. And there's so many costs that go along with our residents not being healthy that the payback for us to just get them to the doctor is manifest. The schedule conflicts. I just looked up the health department's clinic hours, 7:30 to 4. I looked up the UF Family Medicine on Main Street, which I realize is on the edge of what we're talking about, but is at least closer than North Florida or Big Shands. Their hours are 8 to 5. And the Eastside Clinic, the UF Health Family Medicine Eastside Clinic on Waldo Road is also 8 to 5. Well, if you're working an hourly job and if you're fixing buses at RTS, you can't just take off to go get that nagging cough looked at. frankly, even if you have good insurance. How do you do that within those hours? So the question is, what can we do? How can we work with UF Health and with the health department to expand hours? Expanding hours seems like at physical locations that already exist, seems like low-hanging fruit. Because that really, everyone said, not everyone, one of the four most common responses was schedule conflicts. These facilities already exist in the areas we're talking about. So how do we help them stay open longer? Yeah, do we need to help them recruit more physicians, more nurses, more health professionals in general? Do they need more money to do it? What's the barrier? I don't know. I really have no idea how we would approach the health department and UF Health, but that seems like low-hanging fruit to help them open earlier or stay open till 8 or 9 o'clock at night. I'll bet we could change health outcomes significantly if we allow people the opportunity to take their kids to the doctor after work. I mean, I think that's a game changer and a life changer for a lot of people. So that's something I would like to see us approach. And I don't know what the impact on the city of Gainesville for that is, but if we need to provide some help, then we should be willing to do that. I think that the two things that we can do that help the most are pursuing this insurance question and pursuing a transit question through essentially a first mile, last mile kind of model. Another thing that I hope we are able to address through the larger question is that this shouldn't be an ad hoc approach. We are at a point where cities in general, and our city in particular, have to think about public health in ways we have not done before. And if we put a team together that's different every time, we're not going to get this done very efficiently. I think it needs to be somebody's job to think about and act on public health issues on a regular basis who works for the city of Gainesville. Super happy with the work that's been done, but better work is going to be done if it's somebody's job to be the city of Gainesville public health director. Whether that's an office with multiple staff members, probably not, or one person, hopefully full-time, but maybe even potentially part-time, whose responsibility is public health for the residents of Gainesville, and to make recommendations to us and the people who follow us in these chairs. I think that's something whose time has come. So I'll leave those out there. I don't have a motion to make certainly, but I'll just leave those comments out there. Thank you again, Commissioner Simmons, for bringing it forward.
Thank you, Commissioner Santos.
Thank you, Mr. Mayor, and thank you, Commissioner Simmons and the staff and everyone who served in the advisory group. I think you have some great recommendations, Commissioner Simmons. I do believe that your path forward is something that falls into kind of the wheelhouse of what we can do now, of trying to look at what are the incentives to that are needed to bring someone, and then the space kind of considerations. Commissioner Ward, I 100% agree with you too on the hours. That's something that I have trouble with on sometimes when I live, and I go to the East Side clinics where I go, but it can be sometimes when you're working late and stuff like that, it's hard to go. And I definitely do think that trying to find one of those places we already have there is where we should try to see if we can increase that. Kind of following that is have you been able to have any kind of discussions with the county and kind of where do they see their role in this? Because in essence, this is their kind of, in essence, mandate, even if it's unfunded in some senses. But Commissioner Simmons, have you had any kind of luck on that side? I mean, the health department is owned by the county, but it's funded by the state too. But I'm wondering how kind of discussions with the county has gone.
I think what the purpose of this group was to first identify the needs in 32601 and 32609 and 32641. And as it relates to the county, I've spoken to other, the mayor in Hawthorne, other commissioners and folks that are in the eastern portion of the county, and they agree because they lack healthcare, access to healthcare. And so what we wanted to do is bring this to this commission first. But by all means, we're willing to partner, we're willing to talk to county administrators, because that would benefit them too. If you have Hawthorne, Windsor, Cross Creek, those folks in that area, that's eastern Alachua County, that also are being impacted by the lack of access to health care. It would behoove the county at some point to have a conversation with them to help those residents as well.
Yeah.
Yeah, so yeah, definitely we're open to it, but I think as District 1 Commissioner, my sole focus was my district and what can we do as a city to address some of those needs in District 1. That's been an ongoing need for the last couple of decades.
No, I agree. I guess just that those
Yeah, oh yeah.
District 1 residents or county residents as well. I want to make sure we don't forget that in terms of making sure that they hopefully can put some funding toward it. Two other kind of questions that, and it was somewhat kind of gone in there, but I want to get a better idea of, and I guess maybe this is for the advisory group, what are kind of the most needed services that are not provided? And then do we know what the barriers are and why service providers have not come to East Gainesville? Are those known answers to either of those questions?
Ms. Bo, do you have that? So what are the, I don't know, maybe Ms. Keller too, what are the biggest gaps in service, and then why, what are the barriers to those services being provided in Eastern Gainesville and Alachua County?
Sure, I think that's just more appropriate for Dr. Kotler to address. Thank you.
Sure.
And I can address part of it, but I'd like for Wendy Resnick, if she could first of all provide some basic information about the University of Florida and the services. Wendy, are you on?
I am. Can you hear me?
Yes.
So we've had this discussion in the work group, including with folks from Dr. Yuck's practice, emergency physicians. And I think it's, a complex problem. One of the things is, of course, staffing, finding people to staff these clinics at night and on the weekend is a tough thing to do. And I think the other thing is cost, of course. When you're asking people to work nights and weekends, then, the costs increase for that. So I think that's part of the equation. There's just not, you've seen the news with COVID and the other things from the pandemic especially have stretched the healthcare resources, and we're constantly in a state of recruitment for additional staff members. And I think the other thing is that, from a, not UF Health, but from a business perspective, it's the same reason that, grocery stores and restaurants and other places, they have limited capital, so they put their capital where they think it's best for their business interests. And again, I'm not saying this for UF Health, but that's traditionally how things happen in the business world. And so I think that's what's happened with this healthcare disparity. One of the exercises that we've done on several occasions is look at the locations of the clinics. And you know it from living in the Gainesville area, it's mostly to the west of the main street. And, that's just like grocery stores and a bunch of other services. So.
Mm-hmm. And I would just say that from needs assessments, we know that the number one services that people are requesting would be those that are cardiovascular related and diabetes, as well as mental health. And one thing we don't know yet is what's going to happen with the post-COVID effects. And that is going to be a major issue coming forward. So cardiovascular, mental health, and I forgot dental services. Those are the things that people request.
Thank you. And just to get a better idea, kind of diving a little more down onto cost, is it because there's not enough insured patients? Is that why kind of not enough people who will cover the cost? And whoever their insurances aren't paying enough, or people who just don't have insurance and so they're not able to cover the cost? Is what is kind of the barrier to the cost? Is it?
I think, it's a very complicated topic and issue. Of course, there are people that are uninsured, especially when you start talking about dental and mental services, mental health services and dental services. There are a lot more uninsured people than there are with healthcare services in those venues. I can tell you one of the things that we've talked a lot about in the work group is a model like Walmart, and what they're doing is they're opening clinics across the country at their superstores and staffing them, and they have pretty much a cash model, and that's nothing that we've ever used, but they've been pretty successful with it. So I think there's a bunch of different models out there trying to figure out what the sweet spot is. Obviously, you have to be able to cover your costs in order to maintain your business model. And I think, trying to use scarce resources where you're sure you're going to get a return on them is one set of concerns that businesses have. And so, I think the fallacy is that the folks on the east side of Gainesville don't have insurance, and that is absolutely not the case. A lot of people are qualified for Medicare, a lot of people are qualified for Medicaid, and there are a lot of employees from the university, from the state, from the city that live in those zip codes that have commercial insurance. So I would say that, to believe that they don't have insurance is a myth and a fallacy.
Can I jump in real quick?
Of course.
And also, to piggyback what Wendy just stated as well, there's no option for healthcare services. So if I do have Medicare or Medicaid or Blue Cross and Blue Shield, I still need to go across Main Street because there are no options. And that plays a big role in that decision making as well. And there is a misconception about people in the 32609 and 32641 area codes not being able to afford health insurance. And if you also look at the operating costs, there are certain ways that you can scale down a facility. There are certain things that you can do. You can partner. You can have a teaching school come in. There's things that we can do to compensate for the cost. Again, the city can provide an asset. We can come up with incentives. So it's a big myth that the cost is extremely high to operate. Well, maybe it may be true, but there's things that we can do to compensate that.
So I guess request if you could add to the motion. I would like to get a better idea of kind of briefly went over there, but what are the kind of services gaps there are? We've heard cardiovascular, other ones like that, but I would like to kind of get a list of what are those gaps. I mean, recently the dialysis clinic opened up, so that's one thing that kind of is good, but what are the other gaps that are missing? And then I would like to have like kind of a deeper dive into what are the barriers of why have service providers not moved to the east side or opened up, and kind of a deeper dive into what are those reasons. Because if we understand those reasons, then we can create the incentives necessary to be able to get service providers to come.
I think Wendy pretty much stated why there's no healthcare service providers in that area. It's the operating costs. I've had discussions with various University of Florida's health, emergency room folks. I've spoken with the CEO of this healthcare facility, and it always comes back to operating costs. We can, from my understanding and what I get, and I know Catherine is on the call too, and she can probably explain to you in more detail about the upfront costs and the operating costs. And if you had a subsidiary or someone that could come in and assist you with that, and in some instances, some folks are in it for the money. If you get a healthcare provider or some type of healthcare service that really truly want what's good for the community and for the people, then you have a different conversation. But if you're just counting heads and you're just counting what's coming in your clinic every day, day in and out, and your overhead costs, and you're not really concerned about the people, then that's where we have the issue.
And I guess kind of, what is that gap? Is it a $1 million gap that's the operating cost, or is it $100,000 a year, or things like that? I kind of want to know so that we can create the incentives necessary to bridge that gap.
I would like to know if Catherine is she in the room? Omi? Catherine Pattamore?
Thank you, Mr. Mayor.
I don't see her, Commissioner.
Oh, she's not, okay. Well, we could definitely get that information to you.
Yeah, we don't have to
Commissioner.
answer all
Yeah,
the questions
she
today.
can
I think today's, sort of a first pass, and we'll continue having to follow up.
This is Wendy Resnick again. I would just like to add that I think it depends on what the question is. So running a dental clinic there is different than running a mental health provider service there, is different than running a medical clinic there. And so, you know, there's probably not any one provider that can fill all those needs. And there's a tremendous need in those zip codes for services. So just opening one clinic or expanding, you know, one clinic into the evenings is not going to fill that bucket up. But, you know, it depends on what it is you're asking a provider. If you want to scope for a dental office, if you want to scope for mental health services, whatever those might be, therapist or you know, a staff clinic that way.
I guess to clarify, what are the service gaps that are there? Is it mental health, whatever those might be? And then what is kind of the gap that's preventing those, a dental clinic to open or a therapist clinic to open or whatever? I'd like to get a better understanding for each of those so that we can have actionable data to then move forward on. Thank you, Mr. Mayor.
Thank you, Commissioner Taka.
Mr. Mayor, thank you, Commissioner Simmons. This is, I think, a long-expected topic that was needed. I think that the asks that you presented are detailed and organized and good asks that we can act on. But one of the things I'd like us to look forward on is, as far as, I guess, the more immediate way that we can address some of the issue is we have GFR. And GFR's paramedicine program is helping bridge part of that gap already. And so one of the things I talked over with the manager briefly, and I've talked with GFR before, is that there is appetite to kind of expand the paramedicine program to be a sort of walk-in basic health clinic. And so that would be things like my blood sugar, I don't know about my blood pressure, the basic needs, getting our flu shots, and our paramedicine program's already doing some of these with our mobile clinics. The beauty is we have 8 stations, we have 9, but we have 8 stations that have a building, 3 of those being in District 1. And if there could be some kind of carve out in the building, some kind of space set aside, we could have either the paramedicine program expanded or have a nurse practitioner added to the program that can serve outside of those hours. GFR is running 24 hours, 7 days a week anyway. If we could help, that's something that the city can do. Because that's, you know, that doesn't rely as much on other players or other pieces. That is something that we can address in the short run while we get all the other pieces going. And so I don't know if that's something that the rest of the commission would be interested in, but I think it does address the immediate need for some of those lower issues. I do think Commissioner Santos' point of, you know, what are the services that people are requesting would make it more important to know what services we could offer through the paramedicine program, because they would be limited. But I think that it would be a good first step that we can move on a lot more rapidly than some of the others. That said, I do think that looking at the city's real estate assets to see where we could offer incentives or partner with UF or other service providers to get services on the east side, but the east side and the rest of District 1. But I think that looking at GFR, I think as a first step on what we could offer would be good. And I know that it could be something that could be replicated elsewhere if the rest of the eastern half of the county would also like to replicate it through their departments as well. Otherwise, I do think that Commissioner Ward's point of, you know, we have the first mile, last mile program. something that I saw a lot growing up in Miami is the shuttle service for health appointments. It's very common. They're almost all private. But if we could find a way to do a kind of shuttle service exclusively for medical service at a very low cost or a subsidized cost, I think that's a great contribution to this. And that's the whole point of that one shuttle, is to just move folks from appointment to appointment. And sometimes it's not a direct move, but it is much cheaper and helps with the transportation access. Otherwise, I think these asks are good, and if we could consider exploring the GFR option in whatever motion is made, I think that could help us get a more immediate look at where we could help and what we could do and offer. Those are it. I tried to be brief.
All right, thank you, Commissioner. Commissioner Johnson.
Thank you, Mayor. I'll keep it short. I am really thrilled that we're talking about this today, and great presentation, really clear asks, and I'm fully supportive of the asks as well as the GFR idea, and getting some more information about what the basic, the more fleshed out view of what the needs are, so that we can make better decisions. Something that I wanted to comment on about what Commissioner Ward said is about if we are going to consider just moving forward with any of our budget discussions about adding any kinds of new positions, I think that just in the past it would work well for us moving forward to flesh out exactly what the responsibilities would be and to get a better idea of how that's going to move through the HR process. There have been some, I think, gaps in the past with hiring and with moving forward what we want to move forward at it as a commission when it comes, and then being able to translate that into a person to do that in the city has been challenging. So it's something that I want us to think about moving forward if we consider adding new positions. Thank you.
All right, thank you, Commissioner Johnson. So, Commissioner Simmons, thanks for bringing this before us. This, of course, was one of our 5, top priorities that we all came, to consensus around this past summer. I love talking about the big idea and the transformative idea, and this certainly is that. It's also incredibly intimidating. And I think if any of us are not intimidated by this, then we're not taking it seriously enough, because it's frankly an area the city has not been very involved in. The only area of public health we've really truly been involved in for any amount of time is the EMT program, which we do a fantastic job of. Fantastic. I mean, put them up with anybody in the state. Very recently, we've sort of dipped our toe into the broader public health pool with the CRP program. And again, to great effect. I mean, that has been an incredibly successful program considering the resources that have been available. But what we're talking about is a complete culture shift, and that's tough. And so a lot of what I've heard, which, by the way, I don't think there's anything anybody said that I don't agree with in principle, but a lot of what I heard are these sort of incremental tactical steps, like extending hours or expanding transportation. And what we haven't done is agreed on an overall policy and strategy. I'm confident that if we as a commission, in consultation with our neighbors, agree on the outcomes that we hope to achieve, that we can work backwards from there to figure out tactically how we accomplish that. So I'm going to be very clear with what I think the problem is. I think the problem is we have a healthcare system that's based on a fee-for-service model. The more people visit, the more money they make. That's the model that exists. And you got to the heart of it, Commissioner Simmons. You didn't use these words, but it was the same idea, is that we need to shift to a value-based model of service delivery. that you are rewarded based on the health outcomes of the people that you serve. There are models that exist out there that do that. I'm not a healthcare policy expert, but it is my understanding that that is the direction that Medicare and Medicaid have been moving and will continue to move with the new administration. So I think there's opportunity out there. Where the city fits into that, I have no idea. You know, so before I put the blindfold on and jump head first into the quarry pool down below, not knowing how far the leap is, there's some things that I think that we owe it to ourselves to find out. And one of those is, what are other similar communities doing that have the same resource capacity as Gainesville, and the same sort of demographic disparity mix as Gainesville? And they don't have to just be American cities. They can be other places too. But what have other communities done from a local-based public health policy that puts a value-based model at the center of what they're trying to accomplish? The second thing that we need to figure out, and again, not today, but where does Gainesville fit in that? Because so we're talking, I mean, those two zip codes, there's lots of people who live outside the city of Gainesville that are completely underserved when it comes to mental health, dental service, preventative care, and every other sort of measure of healthcare. Are we going to develop these services and then tell somebody from Hawthorne or Windsor, sorry, this is not accessible to you? You know, so I'm guessing we're not going to do that. That's not our way, right? So obviously, a much more developed and very clearly articulated, meaning legally articulated, sort of relationship needs to exist between the city, the county, the healthcare providers. You know, and it could be a private nonprofit entity that does this. It doesn't necessarily need to be Shands at UF Health. It doesn't necessarily need to be something that already exists. It could be somebody new, but it's got to be clearly articulated whose role is what. Now, my first blush sort of assumption, and I'm not married to this, but I mean, I've thought a lot about this, and this is where I think my comfort level is, where I'm confident we can move forward, is I think the city can become a very strong partner and provider of public health services. We're already starting that with CRP. So the identifying the highest users of 911, the most frequent emergency room visitors, the folks that are using the most resources, doing things like mobile flu shots and STD testing and education, and all these other things that it's getting out into the community. I think that's one thing that we can do well. We can get out and meet people where they are and provide these basic things that hopefully lead to avoidance of further healthcare costs and needs for individuals in the future. And then work out with some other entity how to provide healthcare services. The emergency room services and the primary care physician services and clinics, the dental care. It's not that the city can't do that, but oh my goodness, it's going to be a heavy lift, including like a funding mechanism that absolutely doesn't exist. I think the good news for this, so it's not ironic, it's coincidental? I don't know. I'm not going to get into that. I wasn't an English major. Just before this meeting, I was coming from the group that's been put together to um, look at a variety of community health issues, but really focused right now on the central receiving facility. So a lot of the same folks that help you, Commissioner Simmons, and were some of which are on this call, and there is this existing, I think, community recognition and vision that we can do a lot of good if we work together and we find out the right intersection of all of that, from the funding to the service delivery to the being able to reach out and contact our neighbors and identify their needs, all of that. So I think there's a good foundation, but it's that next step that is going to be incredibly difficult. And so I want to allow not just our staff, but all the other people that are excited to work on this, the latitude and flexibility to be able to follow directions that might not have emanated from this dais, but will achieve the outcomes that I think we're all desirous of, which is a healthy, equitable community. And it's going to come up later, with Commissioner Johnson, because I was reading through some of Commissioner Johnson's supporting materials, and a few of you are going to remember this. I know you will, Commissioner Ariola, because you've been, I think, as excited as me and probably disappointed it hasn't gone any further, but the complete communities model. That's really, when I look at this, when I look at Commissioner Johnson's, incredible vision, if we would have been able to get that in place, 4 years ago, looking at what makes for a complete community, that they have great health outcomes, they have great educational outcomes, they have, great, places to play and interact, everything else down the list. That's how you measure whether you have a healthy, successful community or not. And so this is one aspect of, that we've recognized these health disparities, and we're working towards closing those. But these overlap with so much. And I mean, one that came up is transportation. You can't solve health disparities without changing transportation disparities, without changing educational disparities. And so, I think we're wading in. I'm ready to wade in with y'all. I'm absolutely committed to this. But we're going to have to, I think, be a little bit patient with all of the professionals that are going to have to figure out how the pieces fit together so we can understand how we can be most effective in our role as a city, in a county, amidst a very complex healthcare system, amongst all the other intersections of disparity that exist, and how do we do that? So, I haven't heard anything that I am not ready to support, but I want to go back to the beginning. To me, it's about committing and being a part of the solution to bringing a value-based healthcare model to our community as opposed to a fee-based model. And I think if we can start there, all this other stuff can be figured out. So I'm excited. Commissioner Ward?
Thank you, Mr. Mayor. So there are lots of pieces of good news here. The first good news is that we all want to do this. We clearly all want to make a positive impact on the physical and mental health of the lives of the people who live in this community. So that's great. We don't have to convince each other that it's a good thing to do. That's the best news. The other huge piece of good news is that the people in our city who are experiencing the worst health outcomes are just a few blocks away from one of the greatest health centers in the whole world. We haven't figured out how to make the link between them yet, but that asset exists in our community. So it's not like we're in a community, that is 100 miles away from UF Health. We are here. All those resources exist on Archer Road. So I kind of see it as maybe our job as a government entity, as elected officials who the people had enough faith in to put us in these chairs, to figure out how to make that connection. We're not starting from scratch. We know where the needs are, and we know where the assets are. And shame on us if we can't figure out a way to connect those. Or if we say, well, that's not our job. That's a different, the people across the street have to do that. It's our time to get this done. And the job is to make the connection there. And whatever else comes with that, great, but that's the primary job. Huge asset, huge need, how do we make the connection? We already agreed months ago on this sheet right here, this orange spot. It says comprehensive city public health policy and strategy / action plan. We agreed to do this. This is a step in that direction. I want to do the big stuff, Mr. Mayor. You talk about having a comprehensive policy and strategy. I want to do that, but I don't want to do that so much that we don't do, that we miss low-hanging fruit. I want to act on the transit issue, the transportation. I want to act on how we can help keep facilities open different hours, because those are things that people have already said they need. It's low-hanging fruit. We should work with that, and it's not going to solve the problem, but it's going to make some people's lives better very quickly at a relatively low cost. So we need to do this, but these things down here, we got to do too. I know that's hard, and I apologize to staff right now for asking everything that we're asking of you, because it's a lot. I get that. But knowing what people say they need and knowing that it's possible, we have to do that. We have to. That's on us. So I don't want us to walk away from this meeting thinking, great, we're going to do a big thing, and not take action on the small things too. Because they're not small to the people who can't figure out how to get to the daggum docket. So those are more of my thoughts on it. I love where we're going. It's great, but we have a habit, not a habit. Several times I have felt like, man, we are on a great path. I'm so excited about this when I walk out of the building. And then 6 months later, I realize we haven't done another thing on that. So I don't want that. I don't want this to be that again. Let's grab this momentum that we clearly all feel and make great things happen. Thank you.
Commissioner Simmons.
Thank you, Mayor. I'm just so glad we're having this conversation today. It's really interesting, and I'm glad that it's good for me to hear everyone's opinion and everyone's viewpoints, because we don't always sit in the same seat. And so it's enlightening to me when I hear the survey, when Dr. Kotler was talking about women between the ages of 44 to 60 are at the highest risk, and they're the ones not going to getting a health care, going to the emergency rooms, or just trying to just, hold on and just wait it out. And I fit in that description. I'm looking at the audience, Ms. Miles fits that description. So my viewpoint and you all's viewpoint is extremely different. I just heard where we need to wait and let the professionals get together and let's be patient. So how many more of us have to die while we wait for the professionals to figure it out? I came here today with an ask. It's a very direct, deliberate ask that the city can do that focuses on health care in East Gainesville, specifically zip codes 32609 and 32641. I ask that we look at the city's real estate assets including GTEC, which could be used to create a public-private partnerships to expand healthcare services in East Gainesville. Real estate assets, that includes fire stations. I asked to determine if existing economic development incentives can assist in recruiting healthcare services or providers to East Gainesville, specifically in zip codes 32609 and 32641. Those healthcare providers could be physical therapists in the realm of physical therapy, mental health. It's recruiting healthcare services and whatever it is under that umbrella. I asked staff to bring back information for a pilot program to include costs to improve transportation access to healthcare services for zip codes, specifically 32609 and 32641. And that could resemble a first mile, last mile. We currently have that, that's currently going on. So we can readily look at that and have staff see how that can be incorporated into this ask. All I want to do today is focus on this ask, because the team that was put together, if you look in your backup, it's maybe an 18, 19 member team that is overly qualified for this conversation. Overly qualified for this conversation. The CRP program is to the table. We're having that discussion with the CRP folks. So the next step, in my opinion, needs to be, let's start here. This is not a hard ask. And while we do this, engage on the other topics, the other conversations, that's going to be the heavy lift. But while we want to wait and be patient, my people are dying. And I don't understand, what don't you understand about that part? We are dying. I have seen, and I don't know if you can witness this, so many people died this year of color that I have ever seen all the days of my life on this earth. So I don't understand what we don't get about this simple ask. I move that we honor this ask that was created by the Health Equity and Access group. I ask my fellow commissioners to do this ask for my community. And let's have a conversation following this with the other stuff we was talking about. It's important. Everything we have discussed today is important. Everything. Everybody has wonderful ideas. How many more people have to die in this community?
Do you conclude, Commissioner? Okay, Commissioner Ariola?
Thank you, Mr. Mayor. Commissioner, if we could add to the three parts of that motion, to ask staff to come back with a first pass at what a private-public healthcare insurance consortium would look like. If we could also ask them to bring back an update for the CRP phases, because I know that we've added funding for next phase in the CRP, and I know that they're constantly thinking about how they can step up their service. I would like that very much to be added as part of the motion, but I certainly agree with the 3 points.
Commissioner?
It was the original 3 parts
Okay,
that are listed, adding for staff to bring back a first draft analysis of what a public and private healthcare risk consortium would look like for health insurance, and then to bring back an update to the city commission for the CRP, the next step in the phase, in their phase implementations, because I know that where they are right now is just one step of where they'd like to be, and how do we continue to fund that?
I accept that.
Thank you.
Okay, 2 things been added to the motion. Commissioner Santos.
Thank you, Mr. Mayor. I'd like a little better idea on the public-private, on the health insurance. I see you saying, I guess, what exactly do you mean by that? Because it could mean a lot of different things.
Yeah, so if I may, Mr. Mayor, the basic idea is that we purchase a block healthcare policy, and all institutions do that, businesses do that. The idea here is that you can create a consortium, that's the word that I use, certainly didn't coin it, to share multiple risk pools and purchase a larger block of healthcare access. So the idea is that you continue to offer the same healthcare product to your employees, but now, because you're spreading it amongst a much larger pool, you're able to reduce the costs to the original buyer. So this would directly benefit small businesses, for example, that can't afford their own healthcare plan for their employees. This would help. We could offer a set amount to people who can't afford healthcare on the market. That is a huge lift. That's not something that we can just, get done. But to the commissioner's point, there are things that we can get done and can get moving right now. And I would like for that to be sort of along the train cart, so to speak, so that as the train, now I'm using metaphors and I hate them, as the train moves closer to the station of completion, that it's along there to see if it's not more ripe when it gets there.
Yeah, I'm open to exploring it. I have some concerns that that's becoming an insurance. The county did it with choices, and I think that worked. It's just the funding that it costs because of being able to, if we're going to subsidize it or not. But I do have one question or one request for Commissioner Simmons to add. I would like for us to get an idea of what are the most needed services for healthcare in those areas, and then what are the barriers for each of those services? What's the barrier for physical therapy? I don't think there are any physical therapy in East Gainesville. What are the barriers for all these different ones so that we can kind of put together maybe the incentives that work for that? All right, thank you, Mr. Mayor.
Okay, seconder agree? Okay. Commissioner Ward?
Thank you, Mr. Mayor. A couple things I was going to mention earlier. Certainly, I'm totally supportive of this motion. It gets us started. And I'm really, really glad to be revisiting this insurance issue from a year and a half ago. I know that that's a huge lift. And I don't think we're even talking about subsidies at this point. I think what we're talking about is inviting people to the risk pool. And the more people there are in the risk pool, generally, the less expensive the care. So we're not committing to do it. We're saying this is a possibility. Let's figure out how it might work. And we might find out that it's impossible. But I don't think it is. I think we've been working with constructs that we all inherited that said it just wasn't a thing that we do, so we can't do it. I think we can do it. So moving on from that, I wanted to address the public health director issue. Again, I totally agree, Commissioner Johnson. We want to make sure that before such a thing is budgeted, if it is possible to budget it, that we are all clear on what it's supposed to be and what that person or the succession of people who hold that position would deliver to the commission and to the community. I think we should be exceptionally clear and intentional about what the job is and what we expect from it. A concept that occurred to me while we were talking about CRP in this regard is the concept of mission creep. Usually that's a bad thing. I think this is positive mission creep. I think this is taking a thing that exists that we just started, didn't really know exactly where it was going to go, and give it some really serious direction. And it occurs to me that positive mission creep regarding the community resource paramedics. They do amazing work. Our EMS people through GFR provide all kinds of health resources. And if we could give our residents a permanent location for that, as opposed to calling it at a very expensive rate to come to them, expensive to all of us, and put that in one place where people could go get services, basic level medical services, I think that's an enormous step forward, and it's mission creep that works for everybody, I think, and is already existing. It's just a matter of getting it out of the truck and into a building. So, thank you. I'm totally supportive of all this.
Okay, thank you. Could we please put the slide on the, I don't know, on the Zoom, on the shared screen, that had the original 3 asks, and then added to that, the motion includes research and report back to the commission on a health insurance risk pool, the next phases of the community resource paramedicine program, an analysis of the most needed service and barriers to those services. Excuse me. And Commissioner Simmons, I constantly work on being a better communicator and feel terrible when I don't communicate what I mean effectively. I thought I started out my comments by saying I agreed absolutely with everything that you suggested and what eventually ended up in the motion. So I apologize for my inability to communicate that clearly. I want you to know that every time we get an update from the city manager and we're informed of a death, I take that personally. I feel responsible for that death. So I don't want you to think that I don't take every single death, whether it's due to COVID-19 or anything else, without the utmost seriousness. I feel responsible for every one of those. I just want you to know that. Members of the public that wish to speak to this motion, we'll start with anybody in the chambers. You want to speak to the motion? Okay, then Madam Clerk will turn it over. I think we have Larry with us today, don't we?
We do.
Okay, Larry, how are you? Long time no talk.
Good.
We have anybody
Yes, sir.
online?
Yeah, we do. Doris Edwards is standing by to speak, and let me just give me 1 second. I just need to get the line unmuted. We should have Miss Edwards. Miss Edwards? Miss Edwards?
Hello? Hello?
Yes, go ahead. Yes, go ahead.
Can you hear me?
Yes, we can hear you just fine. Go ahead and speak. Apologies, Mayor and Council seem to be having some challenges with her line. We'll come back to her, and we'll go to Nathan Scott standing by. Nathan? Yep, 1 second. Let's try that again.
Yes, Larry,
Nathan?
can you hear me?
Yes, I can. I'm sorry about that. Go ahead. You have the floor.
Yes, Larry. Okay. Yes, thank you. I have no specific on this item, but I note on the agenda there's no general public comment, which I think is a typographical error based upon the mood of the commission and the meeting yesterday. But ask the commission at the end of the meeting to take general public comment. Thank you.
We'll try to go back to Ms. Edwards. It is important that you mute the Facebook feed you might be listening to the meeting on in order for us to be able to hear you. But Ms. Edwards, you have the floor.
Thank you. Thank you. This is Doris Edwards from Southeast Gainesville. And first of all, I want to say thank you for having this conversation, and thank you, Commissioner Gigi Simmons, for bringing this information up and having this dialogue. This is so important. We've worked for my community very closely with the city of Gainesville on health disparities. The Alachua County Health Department has been a blessing to us. We're doing a walk trail with the city of Gainesville, and the Alachua County Health Department is part of that walk trail. They have taught us about the health disparities in the eastern portion of the county, and they're very high. They're higher than most of the other areas. So I'm concerned because I've not seen a meeting to determine how urgent care centers are auto-populated in the northern portion of the county. I've not seen anyone have to sit down and figure facts in order to do it. It's just done. My husband's a healthcare professional. He did anesthesia. And one of the things that he taught me is that healthcare professionals protect people, and they try to minimize the time and cover geographical areas to save lives. So when we look at the health disparities in East Gainesville and realize that they're higher than other areas, why is it that we're not in the formula, and why it's not applicable, that formula, to the eastern area? Why is that? Why is it we don't have an urgent care center for the people that have so many problems? So that's something we need to look at. Okay, who are you protecting? We're people as well. Okay, so we need to fall under that umbrella. So I think this may be a starting point to bring up some of the things we've been working on for the last 20 years. So please continue this conversation, involve the community, and the GTEC building is an awesome choice. It's around an amazing corridor that links right into our walk trail, which we're going to be doing exercise and a lot of other things. So I think that that's a more appropriate thing that we can do with that area, as opposed to putting more low rent housing and more people with more disparities. The layer cake needs to stop at some point. So thanks again. I appreciate you very much.
Mayor, we do have one additional caller. I believe that the caller is Nancy Darren. Caller, if you could identify yourself and let us know if you wanted to speak to this healthcare item.
Yes, Nancy Darren, and yes, please.
Please go ahead. You have the floor.
Hi, Nancy Darren. I am so thrilled at this whole conversation. Thanks to everyone for their contributions. Mayor Poe hit the nail on the head. We are fighting a profit-driven, fee-based system. It's not about health at all. It's about profits. And so to reframe this as values-based healthcare, as Mayor Poe described it, I would really encourage incorporating, we're looking at a prevention model that, yes, we have to deal with the disparities, with the crises going on, but things like expanding the CRP program, which is all focused on prevention and avoidance and not needing the world-class healthcare hospitals and stuff that we have nearly as much. So if you frame it around the umbrella of a prevention model, and food is a huge, huge piece of this, so many of the comorbidities and even mental health illness is connected to the kinds of unhealthy and unnutritious depleted foods that people are eating, especially in those zip code areas, is what's available. So as part of a prevention model and public health model, the food piece needs to be a part of that. So I'm thrilled, as a former RN who did her public health unit in tiny towns in western Colorado, this is the way to go. And the countries that put clinics in neighborhoods, put nurses and doctors in neighborhoods, and having the preventive primary care be readily available, we can start to whittle down the crisis management. Thank you.
And Mayor, that's our last caller.
Okay, thank you all very much for sharing your thoughts. I'll turn back to the commission for a vote. All in favor of the motion say aye. Aye. All opposed? Motion passes unanimously. All right, our next item is Economic Outlook and First Community CDC. And I'll turn it over to Commissioner Johnson.
Thank you, Mayor. So I would love for us today to have a kind of a high-level discussion of the economic outlook for the city, resiliency, recovery, and also introduce a new CDC in town that I think will help to fill some of the gaps that we need here. It's the beginning. I've been becoming increasingly concerned because, you know, just on the ground, what I've been seeing with some of the needs that are not being met in our city. Evictions are up, houselessness and homelessness is up, the need for food and basic needs, I think we need to address. So there are two, you know, I love that it wasn't on purpose that this happened, but I love that, you know, today we're talking about health. And, you know, for myself, I'm going to frame this as the economic health of the city and also the health of our citizens and what that means. So what I've asked our city manager and our general manager to do is give us an understanding of where we're at within the midst of the COVID-19 kind of economic crisis in our city. Like, what does that mean for specifically the city of Gainesville? So I've asked them to talk about the overall revenue, where we're at with the general fund, where we imagine, you know, the sales tax, gas tax, all the different types of taxes, contracts with UF that might impact our fee collection for bus service. You know, the state is going to be, we're going to have less revenue coming from the state. How's that going to affect us? So really, I just want to start planting seeds about what we need to begin thinking about for the budget. Also get an understanding of where we're at, where the gaps are, where we might be able to assist, and also have a discussion amongst us. It does not have to be in depth because we really have a lot to get to. But I want to understand what, one, the general manager, two, the city manager, and what we think of as a healthy city, how that relates to also something that is in our strategic plan, our social determinants of health, and hopefully move forward on some of the work that we want to do as a commission around that. So the way that I'd like to start is the general manager and the city manager can answer some of these questions. This is kind of like just a guiding document of thoughts that I had, and I asked them to address that. So I'd like for them to start with that, and then move to any other charter officers that might want to weigh in, and then I would like to you know, talk amongst ourselves, and then end with the well-being index. That's where I'd like to go. So if either the general manager or city man, and then at the end, and then the CDC. Yeah.
We can
take that.
We can let you go.
First?
Yeah,
Go
Ms.
ahead.
Miles, if you want to go first, yeah, if you're here for this, the other guys are on the payroll. So why don't you come on up and share the idea, and then we'll make sure we kind of weave back around to it at the end.
Right. I so appreciate that. And I do have other appointments. So again, my name is Carla Lewis Miles, for the record, and I wanted to talk to you all a little bit. If you have the video ready and you can play that for me. If not, I'll just skip right on.
I'm sure they can. Y'all ready in the back for a video?
Yeah, we actually have it. Just one
Oh,
moment.
okay. Thanks, Ms. Gainey.
Have you ever seen a new development pop up in your neighborhood and said to yourself,
Who thought that was a good idea?
we all want revitalization and for the health of our community to grow, but we might not always feel like we have a seat at the table. Community development corporations bring all of the neighborhood stakeholders together to form a cohesive vision for revitalization. Stakeholders include residents, developers, government entities, and anyone interested in making a positive impact on the neighborhood. That means everyone is working towards common goals in economic and social development, education, community engagement, job creation, and more.
That's cool. Do we have one of those for my neighborhood here in Gainesville?
I'm so glad you asked. We're forming the first community CDC to benefit the greater Duval neighborhood in Northeast Gainesville right now.
That sounds great. But is it hard to join? Are there fees or restrictions on being a member?
Actually, it's really easy to join. Whether you're an adult community resident, a youth resident, an affiliate, or a friend of the neighborhood who believes in the principles of the First Community CDC, you can join today. We're ready to go, and all we need is you. Let's get together, and then let's get to work.
All right. And kudos to Dr. Kristen Joyce and the students in her graduate program at University of Florida who have helped me. So I wanted to talk a little bit about First Community Development Corporation. And just to give you a little bit of background, I first learned about CDCs at a conference with Nancy Darren out in California. And I was explaining to someone about Greater Duval Neighborhood Association and its strategic plan with the 9 initiatives used to address the social determinants of health. And he suggested that I expand that. And he said, you're actually operating just like a CDC. I had never heard that before. I thought he meant Center for Disease Control. So I didn't understand how it related to me. But he began to tell me about these institutions that were created in order to not only help cities and counties build capacity, but to restore equity and to make sure that the development is being done from a community standpoint, and so that growth is not problematic to the city. Here in Gainesville, where we have the University of Florida, we need to be able to grow and expand. Our college needs to be able to grow and expand, but we have to do that in such a way that we're not marginalizing or displacing our citizens. So we started talking. We have a neighborhood revitalization committee that meets through Habitat for Humanity, 13 members. We started last year to explore. I did the research for CDC and how it might fit here in Gainesville. I used Franklin County CDC as a model because their demographics match ours and because they've done such great work in helping restore economic development there in Massachusetts. So the purpose of this corporation is to stimulate a more vital urban and rural economy, to maximize community control over our future economic destiny so that it's sustainable. We're wanting to improve our agricultural value chain, our food system, and expand housing, health, and educational opportunities for low and moderate income individuals. That's a huge undertaking, and I agree with Gigi Simmons when she says we can't wait on these processes any longer. I appreciate all the conversations. One of the reasons why I enjoyed that conversation on health so much is this particular entity may be that gap bridger that Commissioner Ward was talking about. One of the things that these institutions are known for is building capacity, not just to do the work, but also to help get the funding, because we know our city is pressured with funding. And so to create a separate agency that can take some of the work, some of the burden and pressure, not just off the city and county, but off of individual nonprofits that are doing grassroots work in our community. This corporation will combine those efforts and make it collaborative so that we're working as a unit to address social issues, having more of an impact in our entire county and addressing multiple things at once instead of putting out small fires and playing whack-a-mole is kind of what we do with social issues. We put this out and this pop up. This would be a unit that's able to address multiple issues at one time, and it would be a collaborative effort of partnerships. And so where we are now, in order to create this organization, it's a 501c3. That's the best structure. Those are the structures that get funded the most from the government. And so we want to make sure that we're positioning ourselves in a good place. We have multiple agencies that have been a part. We've had multiple meetings with some of the same professionals that Commissioner Simmons have worked with, like Dr. Kotler and Dr. Lisa Chaco, to look at what healthcare looks like. We work with several groups to look at what economic development looks like. We work with IFAS, UF Field and Fort, Working Food, to look at what our food systems, how we can empower our farmers, keep up, make a better agricultural system here in Gainesville, so we're not relying on giveaways when we have something like a pandemic. We have a sustainable system where we're able to feed our residents regardless of what the culture or what's happening in the world. And so we sat down, we've been working for a year. We started off with sitting down, trying to flesh out what our values are, what we're gonna work on a lot. You all know I serve on several boards throughout the city. I work a little bit in education. I've been working in food systems. Been looking at, housing is my forte. I'm a healthcare professional by education and trade, and so I have that experience as well. And I was looking at a way to combine them all using multiple partners. So our Neighborhood Revitalization Committee, which the city of Gainesville has been a part of since we started with Habitat, and Working Food, GRUs, CWC, and other organizations that are part, we've been fleshing out what a CDC would look like in Gainesville and how we should structure that to address what's important here, because we have to make sure that we're customizing our efforts so that they're actually beneficial to our community the way they are. And what we've done so far is created a 501c3 called First Community Development Corporation. Currently, the governing body of that CDC is the Greater Duval Neighborhood Association Board of Directors, who's Greater Duval 501c3. We've already did our DBA. We've already created the institution. We've set our mission statement, our vision. We know what values we want to work on: healthcare, housing, development, and we also have some sub-services that we're going to make a part of the CDC, because like Commissioner Simmons stated earlier, we have to address multiple things. We have to talk about the transportation, infrastructure, and everything while we're talking about development. We can't do them separate from each other. And this organization will help the city and the county to facilitate that work without pulling so much from staff, without slowing down government processes, and without further stressing out our budget here at the city. And so the Greater Duval Neighborhood Association is going to be the governing board. Hopefully the goal is to make this an independent entity, but for the steering portion and to set it up and to qualify for funding, we had to get established and get incorporated. So we're a part of Greater Duval Neighborhood Association for now. Right now we're seating our board, and here's where the change is going to come, because typically our neighborhood association and the way they're set up is basically to guide our services and things for our particular community. Because the goal of this institution is to address inequities and economic disparities in all of Alachua County, we had to make the base of it a little bit broader. So the one thing that we did, we discussed in our last meeting, we had our first draft of bylaws created so we can start getting a governing model and getting our structure down. But we also discussed who's going to be at that table and how we're going to seat it, because our main goal is to make sure that this is a community process long into the future, that it never loses its community concept. I've done plenty of research, and a lot of the research suggests that where there is no community intervention, processes do not work. So as well-intended as some of our anchor institutions are, they're not successful in really moving the needle in our communities because there's no community intervention to tend to those sensitive issues that are particular to us. There are no conduits to help build that relationship and build that trust between the community and the anchor institution so that we can make sure that the services are getting where they need to be. And so our board will be set up with a foundational 5 community seats. Greater Duval Neighborhood Association will always maintain a seat at that table, but we also wanted to make sure that there were other community groups in Gainesville that were able to be a part of that board where they're making decisions, and also leave open 2 seats for rural Alachua County to seat as well. Also on that board, it's important to us that we look at our anchor institutions, our governing bodies, and make sure that they have a seat at that table as well. So that when we're working in the Community Development Corporation, we're making sure that we're working according to the plans that the city and county is having, and that now we're not working against each other, because the goal is to build the capacity so that we as a city and county can grow effectively together, and the burden doesn't end on one entity. And so we want to make sure that there's a seat for the University of Florida, because we ask UF a lot of times for their resources, but don't create a clear pathway to let them be involved in the process. And so we want to guide the process, and we want them to be able to have a way to support us in creating these healthcare programs and those type of things that could, like you said, Commissioner Simmons and her group did a great deal of work on the why we need it and what we need to commit to. This organization can work with her group now to say, we can give you the foundational. One of the things that we did was a feasibility study. I heard Ms. Edwards talk about healthcare facilities and emergency rooms and those type of things on our side of town. Might not be the best fit, but I also heard Ms. Darren talk about preventative care and how we can reduce our need for those institutions. And a lot of times it comes with changing our lifestyle and our food systems, and working collectively to address nutrition and health and those things is just a small component of what we're able to do. Also, we're going to be working on creating economic programs so that we're able to bring and empower small businesses that live in our community. We are concerned about our food systems and what's happening with our Black farmers and their land. And so we have to be proactive. If we can have a goal, that's great to have a goal, but if we don't have a clear-cut pathway to how we're going to get there, and if we don't develop the tools that we can use, also included in this is things like processes like land bank authorities. They may not be the best thing in general, like we're going to have this one and that's just what we're going to do, but to have that tool as a part of that Community Development Corporation, so if we need to compete with land, and we can take the time to make sure that we're developing every development in succinctly with the neighborhood that we're developing for, to make sure that we're fulfilling needs and that we're making the best use of our dollars, since they are few. And so we're getting ready. The 4 institutions that we're looking at joining that seat at the table with 5 community members is our city, is our county, the University of Florida, and then we're going to leave an open seat. And so the other thing I wanted to talk about was funding. So one of the things I did, like I said, I did research prior to. Community development corporations are typically funded through government agencies, and the Local Initiative Support Corporation, the LISC Corporation, is the biggest funder of these processes. Fortunately and timely for us, the LISC Corporation has actually started a 10X program, a program called Project 10X, where they're committing $1 billion. I can tell you during my research, they found that community development corporations is a needed piece, but missing in North Central Florida. And Florida as a state has the least amount of these corporations. I think down in Fort Lauderdale, if I'm not mistaken, one of the southern states have the need for the corporation so much that they actually contracted with a community development corporation from Michigan to come in and do their community development corporation. One of the things that I found during my research as well is that there are many models. There are community development corporations that are ran by institutions, and those don't typically get funded well. They're membership organizations, they're funded by members, but they don't have the impact that we're looking for. And they don't change the community, and they don't change social issues, and they don't drive the force like the community-led processes do. The community-led processes work, and so those are the ones that the LISC Corporation typically funds. Why I'm standing here before you today is not so much to make a motion or a particular ask. It's just to put this on your radar. I want you all to know that we're creating this. I want you to know that as soon as as we start talking about seating the board, we're going to be back before you as an agency, and we're going to be asking that the city help us and commit to a staff member or a liaison that can be a part of that. That person would represent you all in our organization and make sure that we're getting all of your goals and things fulfilled as well while we're planning our programs. We're doing it holistically, so we make sure that the University of Florida has a place for their students to come, and do I know that's important to them, that they're able to get that practicum in to prepare. That's one of the things that they do well, and it's an asset to our community. Work in healthcare, so we want to make sure that when we come before, and I'm going to do this presentation at the Board of County Commissions as well, because I'm going to ask you to give us a person so that they can help us. And when we prepare for funding, we're going to sit and we're going to be strong enough. What we would need from you all is a letter of support to say, hey, our city supports this organization. And so in order to get that, I would think if I was going to do one for somebody, I would want to be involved in that process and see what it looks like to make sure that it fits my values. And so I'm standing here before you today to put that on your purview, start thinking about somebody that can help us, and also think about this organization. Start looking at community development corporations, especially the one in Franklin County CDC, because their programs are robust. They're easy to, I wouldn't say easy to access, that's the wrong thing to say, but it's doable. And they match our demographic. We have a school here. They have one of the examples, they created a residential program. So they took workers and they started a laundry service, started it really small, but now these group of residents have their own business and they do laundry services for the entire city and county. So everybody comes, they're expanding, they have multiple members, and that's an economic tool that they have in their city. They get the contract. When we have places like Shands at the University of Florida and different people, how do we shift their capital to where it's working in Gainesville? We can ask them for donations all day long, but if we created a process that will be ongoing, then that impact will last us a lot longer than a check would last us. And so what we're trying to do is create these processes in conjunction with our city and our county so that we're working as a unit to address social issues. Are there any questions?
Commissioner Santos?
Thank you, Mr. Mayor. We need a community development corporation. It's been a struggle. There's a lot of things we could have done for years with that one. What is your kind of timeline? I mean, getting a nonprofit takes a while, but I guess you're starting that under the Duval, but what is your timeline to, I was looking at the Franklin County and they're 10 staff members and they're pretty large.
Right.
What is your kind of timeline to get started and kind of your...
Okay, so let me tell you where we are on the timeline. So our first year was done in research, so we're on year 3. So that kind of tells you how long this actually takes to set up. So our first year or so was done on research so we can find a model that actually fit our model. And then we had to come before our committee, and we worked the first year we did research. Next year I started pulling in people that were interested, trying to do the recruitment, trying to see, who thought this was a good idea. That took a lot of education, because when I said CDC, people thought the same thing I thought originally. So we did the education piece. For the past year, we've been setting up the structure. We did the 501c3, we did our mission, we did our vision, and now we're moving to our board. When I do, and every year I go back to my funders or my possible funders and I go, am I moving in the right direction? What can you give me? What does it look like? What am I not doing? Who's not at the table? What should I do? And they just tell me to keep moving forward in that direction that I'm moving. And so now that I am trying to seat a diverse board, once that board is seated, I'm imagining that we will start to take advisement from them. I can't say, for a year or whatever. I can tell you that once the bylaws are set and our board is seated, we qualify then to start to file to write grant for our startup. Once we get a startup and an executive director, somebody who can kind of do these processes, because y'all know I got a million jobs, but somebody that can actually kind of start to do the legwork on it. And then we'll know more of idea when they're going to pull apart and be separated. However, they are functioning. They have their own bank account. They have their own numbers. They have their EIN number. So they're operational and able to receive their own funds that are separate from Greater Duval funds.
Thank you, Mr. Mayor.
Thank you, Commissioner Simmons.
It sounds like a great idea. Can you send us some more information about it, especially with the Franklin County?
Absolutely.
Okay.
Absolutely. And I do, Commissioner Simmons, I did have UF create also a PowerPoint for me, but I hadn't passed that through my committee yet to put it out in the public, so I didn't want to do that. The video I did show them, and that was okay. So everything that we have, I'm going to be sending to y'all, including our work plan for the past 2 years, so y'all can know kind of what work we've done into it so far here locally.
Excellent. We'll look forward to that. Commissioner Ward?
Mr. Mayor, thank you, Ms. Miles. I appreciate the presentation, and I had several questions, but I have enough of them that I think what I need to do is set up a meeting and
Absolutely.
have a better conversation about it. But
Absolutely.
I think it's a great move forward, and I'm looking forward to it. Thank you.
Thank you.
All right, well, thank you.
Thank you.
We'll let you get to your next job, whichever one of the dozen you have that's next. But yeah, thanks for spending some time with us today and helping educate us on this. We'll look forward to that next round of information, and then just see how the city fits in with this as you move forward.
Absolutely, and I'm always available one-on-one for anybody.
All right.
All right, thank you.
Okay, Commissioner Johnson, want to go to the charters now?
Yes.
Yeah, okay, so let's start. Mr. Bolarski, are you ready? You want to start?
Yeah, I'm here. Thank you, Mayor. Yeah, I'll go through and kind of talk to each one of the questions that you posed to us, Commissioner Johnson, and kind of give my insight. There's some backup there for people that want to see more of a narrative. But the first question you asked was related to economic outlook for the next 2 budget years. And, I think, history is prelude to the future in a lot of cases. So I think it's really important to understand that, what GRU's brought before the UAB and the City Commission over the past couple years has been really important to where or how we're looking at the future for GRU. It highlights the importance of planning and addressing issues as quickly as we can. So just for a little, trip down memory lane a little bit here, you all remember back in 19, we undertook a bond refinancing. We called it the 2019 transaction, and it reduced debt service up through, I think it was fiscal year 25. And it allowed us to, get a breather, if you will, and put our finances in even better order. We developed some leaner budget. Pardon me?
No, okay. You're fine. Somebody else is unmuted.
Okay. So we developed some leaner budgets over that period of time. One of the actions that was taken, we froze the GFT at the current levels, and we're working toward a formula-based GFT in the future. You approved us bringing the biomass contract employees over to city employment, and it saved us approximately $1 million a year. We deferred some big ticket items for multiple years. We've developed a cash reserve policy that ensured, maintenance of our bond ratings. Just this past year, we seized on some incredible market opportunities to refinance and restructure some debt. And we, originally had cut over $2 million in operating and maintenance spending. So we've really done a good job of putting us in a situation of having a secure future for the utility. And what it's allowed us to do is weather the effects, the impacts of the COVID pandemic. And we think that we're really prepared for any resurgence of that COVID-19 pandemic or any hurricane weather type effects in the future. So if you want, I'll just go through, each one of those. So the other thing moving forward is bottom line. We continue to need to modernize the utility. We're an organization that builds a lot of long-lived assets that require maintenance, and we have to prepare long in advance for changes in a disruptive marketplace. So, it's still important to understand that we'll have utility rate increases That's part of the outlook in the next couple of years to attract and retain employees and, actually to sustain the current level of the GFT, which I think is so important from Lee's perspective on fulfilling the, the programs that are being employed at general government. So on the revenue side, any worst case scenario, you got to consider the continued loss of commercial power consumption that we've seen. That's translated into more folks, living at home, and maybe some residential retail type customer consumption is going up. But I think what we're looking at is the possibility of kind of the effect after the Great Recession, when people changed their habits and then those habits continued. I think we'll have the same impact from this pandemic. And we could see a fall in retail energy sales of 1% to 2%, over the next decade. I think what that means is that over that longer term, we're going to have to continue to look at, putting GRU in a better fiscal position. We certainly in-house are looking for greater efficiencies, the need for continued open position freezes, diminished spends on projects. There's the possibility of a reduction in the GFT, use of higher levels of reserves, and the possibility, and the mayor's mentioned this on several occasions, the acceptance of some bond rating reductions that might result in some hiring borrowing costs, but that may just be the nature of the beast as we move forward in becoming a new utility. But we'll have more information on that when we pull together the budget for fiscal year 22. And the good news about all of this is that GRU isn't beholden to any particular customer base. It's not, in years past, people have talked about getting a big commercial customer that would, drive lower rates for the community and things like that. But of course, that comes with a risk too. And that is when you lose that customer, you have that aberration that is hard to rebound from in all truth. And, we have a lot of diversity in our customer base, which is constantly brought up when we talk to the rating agencies. The other question that the Commissioner Johnson raised was, what's the 5-year horizon document, if you will, for GRU? And I think it still continues to be GRU at a crossroads. I think we isolated the risks and the rewards in there pretty nicely. But I will tell you that I think the 5-year horizon is probably more greatly impacted by some of the structural, financial, and operational elements of the organization, not so much by the impacts of COVID-19. And in a lot of ways, that is good news. The other question that was asked was the SWOT, analysis, strengths, weaknesses, opportunities, and threats, how we're addressing them. I think the biggest threat that GRU has right now is, how does it reach its 2045 goal of being renewable? How do we, choose that new technology with a utility of this size and this magnitude? It's hard to make, a mistake in the choice of a new technology. So in certain regards, we're taking it slow, yet at the same time, we're far ahead of other utilities that are in the state. So I think you have a very engaged organization that's trying to fulfill the mission of the City Commission. But the other gaps that exist really are on, some of the elements of competing goals. We have an electric system that requires rate increases, yet we have some of the highest rates in the state. We have a telecommunication system that, is financially not self-supporting right now. We're doing things that try to put them on better footing, but at the same regard, there's pressures to provide municipal broadband service. We also have flat and declining revenue growth against overwhelming at times and continued regulatory requirements, increasing the underlying capital that we have to spend and the operational financial needs. And it's particularly bad on the electric side of the business, where we also have conservation that reduces consumption, reduces revenues, and our territory is really geographically constrained. But look, this is the point of a SWOT analysis, right? They're the weaknesses, they're the threats, but the strengths are evident by our AA- rating by the bond rating agencies. The strength is there in our reserves. The strength is there in our really diverse customer base. And that's something that the management team at GRU balances on a regular basis. One of the questions was, what's the GM's philosophy about resiliency? I think resiliency encompasses everything from the macro level at the utility down to the very, customer level on the street. So my idea of resiliency is the economic viability of the system that we operate. We're trying to ensure access to capital so that we always have a free flow of funds so that we can stay modern and we can offer the customer a valuable product. I think it's about the ability to serve the needs of the community. What we provide, it's funny coming right after Carla, who is, like a community guru. And, she serves us well on the UAB by always focusing us back into what does the community want. And, that's part of resiliency, providing that the service the needs of the community. We also have to sustain operations through all the weather events that we incur, climate change that's with us now. We have to embrace storm hardening and weatherization. The other part of resiliency, I think, is being, kind of the Gainesville employer of choice. I mean, we really relish the role of being the employer in town that sometimes a lot of people complain about, but everyone wants to work for. And I think the people that we have are proud to work for the utility, and they have the opportunity to grow. And as Yvette Carter says, be your best self every day. We also try to provide the value service to the city of Gainesville through the efficient operations, whose profits we turn over in a general fund transfer. We try to optimize that general fund transfer ability for the city. And the other last element of resiliency for us is being environmentally sustainable as well as being economically feasible. And that's always the cutting edge issue for us, how to balance all these issues. And so in a lot of ways, resiliency to me is about sustainability, and it's about making the utility the best it can be. The other question that was posed was, how are we addressing energy security and water security? And I know from Commissioner Johnson's discussions in the past, a lot of that goes down to that customer level. But I started with this from the macro level. And I think what's really important to understand about both our energy and water security is that a long time ago, GRU decided it was going to be self-sufficient. We were going to islandize. We were going to have resources here, whether systems around us had no resources or didn't have any resources. So we comply fully on the electric side with North America Electric Reliability Corporation, which we call NERC. And we do it in what I believe is a much better way than most of your investor-owned utilities who are hit with fines and things like that. We have people on staff that have been critically acclaimed for the work they do in maintaining the security for our energy supply and distribution. The people that work on our system are people that live in and around Gainesville. They're our friends and our neighbors, and they're ensuring on an everyday basis the power supplied from our generating units. So, it's very unique to have that, as well as the water security that we have, where we use our own well fields. We have a state-of-the-art system in our wastewater system. Most everyone's been to Sweetwater wetlands. We supplement our wastewater system with the passive remediation with that has been incredibly valuable for the organization. It's brought costs down. It was a lower capital cost. And so it's incredible what the organization has done on an energy water security basis. And the number that's everyone always brings up. And, we return 70% of what we draw out of the well fields back into the aquifer. That's just an incredible statistic. And that's sustainability, that's resiliency, that's reliability. And that's what we strive for. So getting down more to that street level, it's the trends and outlooks with shutoffs. It was posed by Commissioner Johnson. I'm really proud to say that between April and September, we disconnected less than 1,400 customers compared to approximately 24,000 in the same period last year. We would have liked to not disconnect anyone, but 1,400 compared to 24,000 is really incredible. We extended payment arrangements for people that had continuing balances as they went into the fall and winter of this year. As far as I understand, the shutoffs are continuing to remain lower, although I think when we return to normal operations, we will see a fair amount of shutoffs over the course of the year. It's the way the system works. I think that having the AMI project, which will be coming forth to the City Commission probably in January. We have to talk to the UAB, but we're to the point now, after your approval of the CIS project, having AMI with its smart meter technology placed on top of our customer service will help with future shutoffs. It will help with folks that have bills that have maybe been escalated because of water leaks. I think we'll have the technology that will be, it's actually in the quotes, it's in what we're striving for, is to have the ability to communicate through some algorithms within the programs to identify when folks are using more water, could be possible water leaks. The same thing on the electric side. It will make audits, energy and water type audits more efficient. Will let us know when meters aren't reading correctly before we get calls from customers when they get their bill, and we'll be able to be proactive. As well, we'll be able to have some customers that will be able to access the meter readings themselves and be able to take a proactive approach in how they handle their consumption of energy. So I think it's a win-win for the community from the utilities perspective as well as the customer. So I'm optimistic about that. And she didn't ask for a summary question, but I will tell you that I think it's really good that Commissioner Johnson asked these questions. I think we have to always reevaluate where we're going as a utility. We have to mesh our goals and objectives to that of the City Commission and the UAB. But when we look at things like the SWOT analysis, I think, and it's forgotten from time to time, the overwhelming value that GRU provides to the city of Gainesville and the surrounding community. The providing of $38 million of general fund transfer on an annual basis, employment of over 800 skilled neighbors that are, some of Gainesville's finest workers, having a platform of energy and water treat independence within a community as self-sustaining, locally controlled electric, water, wastewater, and natural gas utility. We provide utility services that are environmentally friendly as any utility in the state, and probably more so. And we adhere to community services that have included extraordinarily caring philosophy in terms of our customer base. And I think we have an absolutely best of breed coordinated approach to overall city services and integration with almost every city department, general government department on a regular basis. So, are there risks in owning a utility? Yes. But are there rewards? I'll tell you what, people of Gainesville see it every day. And I'm proud of the folks that work at GRU and what they provide to to the system.
All right,
Go with
thank you,
that.
Thank you, Mr. Pilarski. You've got several lights on here, so stick around. Commissioner Johnson.
Thank you,
Sure.
Mayor. Thank you, Mayor, and thanks, Mr. Bilarski, for the insight that you've given us. So there are two questions that I have. One is, one of the reasons why I wanted to have this discussion and information sharing is that I have been concerned about the trend of COVID-19 and what financial impact that's going to have. And to put it, clearly, it seems to me what you're saying is that outside of what we've already known and outside of the 5-year plan that we have and outside of the resiliency and everything that we've talked about, that the only thing that we really have to be concerned about is a potential 1 to 2% decrease in our commercial customers. Is that what I'm hearing you saying, that overall the COVID-19 impact is going to have on the financial outlook for GRU?
Yeah, that would actually be for the overall retail customer base.
Okay.
But
So it feels like nothing to see here. That's what it feels like, but that's not what it feels like. But it seems like that's what you are the expert. So I'm relying on your expertise. But that's overall what your projections are.
well, yeah, I mean, obviously it can be worse than that. I think we've weathered the storm, and we've been responsible in what we've done. Yeah, I don't want to seem like it's minimizing the impact. I mean, 1 or 2% on our revenue base is not inconsequential, and it has upward rate pressure, and that's not easy for you as the commission when there's upward rate pressure and we come back and say, yeah, we're all doing fine, but we need to see additional rate impacts. So that's why it's easy for me to minimize it when you're left with having to deal with that decision making.
Yeah. So there's the business side of it, and then there's the impact on our customers. And what I'm trying to get at, which I don't feel like I have a clear understanding of, is yes, there were only 1,400 cutoffs because last year there were 24,000. Can you remind me how many GRU customers we have?
We're at about 95,000, or guys, 96,000 electric customers.
So you're saying a quarter of our customers are cut off, are cut off? A quarter?
Well, we do have some people that repeat in those figures. I don't think they would be a quarter of all our customers. You'd almost have to look at those 25,000 over a denominator of 96,000 customers times those amount of months to look at the amount of cutoffs as compared to the services on a monthly basis.
Okay.
But yeah, we do have some folks. Now be aware that that might be cut off for a day, a couple days, or until the money is there to pay it.
Do you have an understanding of how much different it is than last year?
I'm sorry, I was talking when you were. I apologize.
Do you have an idea of how much different it is than last year? I mean, I know that we had this program in place which alleviated some of our shutoffs, but were we able to get an understanding of how many more there could have been if we didn't have that program in place?
Well, that would have been the 24,000. I think that's probably fair to say.
But that was 24,000 last year, right? So what could it have been this year with the pandemic and people losing their jobs and people not being able to pay their bills? I'm really trying to get a metric for how much worse things are getting for people and our neighbors based upon them not being able to pay their electricity bill or their GRU.
Yeah.
We don't know that.
I really haven't looked at it from that perspective. I can ask some folks to, kind of extrapolate the numbers that were carried over into the long-term payment arrangements. I mean, it's certainly more than the 24,000. Is that number 30? Is it 35?
Yeah.
I'm not quite sure.
I think that would give us a really good understanding of the need in our community, because that's one of the things that you just would absolutely do your best to pay is your electricity bill. And if you can't do that, then what else are you choosing between? So I'd be interested in that number. Okay. Thank you. Yeah, really good information. I think that our utility was built for, and you're clearly thinking, and we all have been thinking about sustainability and resiliency. So I am looking forward to the budget discussions. When do you think that's gonna? I know that you all are always working on the budget, but what do you think is your timeline for when you're going to start presenting things to us? Because I think we're going to have to make some hard decisions that I'm not excited about making.
Yeah, we do have a kind of a perpetual budget process, particularly with the things that we have to do on a financing basis. So we've already started working on it now. I think we're bringing a budget calendar to you that when we get back from the break.
Fantastic.
And I think that will have some dates set out for you all. And, it's up to the commission whether they want to see a little bit more, some earlier dates, a little longer period of time. We're certainly flexible and all that, but we have some exciting things to bring to you.
Okay, thank you.
Thank you, Commissioner Ward.
Thank you, Mr. Mayor. Thank you, Ed, for bringing this information to us. I guess a metric that would be useful to me would be a couple of them. Would be how do our shutoffs compare with other communities, with other systems, and more so than shutoffs, how is our delinquency rate as compared to the fall of 19 and the fall of 18? Those are metrics that would be useful to me, because not that there's a competition, but if we have more cutoffs than Tallahassee Electric or Orlando or whatever on a percentage basis. So I don't care about that. I'm not worried about the actual numbers. I'm concerned with the percentage comparisons. If we're cutting off, or we have a higher percentage of late pays than those systems, then there's something that is unique to Gainesville that we need to address. But if we're on par with other communities, then it's probably a little bit out of our hands, and anything we can do is probably sort of around the edges of the real problem. So if we could get those, that would be useful to me. Yeah, that's good for now. Thanks.
Commissioner Simmons.
I could answer one thing, Commissioner Ward, and that is that I know each year we look at the amount of bad debt we have, the delinquencies, and I know that we do much better than other utilities. And I will try to get that shut-off information together. It's we kind of do a round robin with some of the other utilities, and they share some of that information. Everyone is probably pulling that kind of stuff together now. It'll be a good exercise, and I'll share it with the rest of the commission.
Great. And if I could say one other thing, Mr. Mayor, that as usual, comparing to Tallahassee is important, because we have an issue that lots of cities don't have, in that there are specific times of the year when we have a lot more cutoffs, not because people don't have any money, but because people graduated and left town and didn't bother to pay the bill. That's a thing that we have that Jacksonville and Orlando and Tampa really don't, on a percentage basis, face. So thank you.
Thank you. Commissioner Simmons?
Thank you, Mayor. And I would like to take it one step further than Commissioner Ward. Ed, if we can have a breakdown of the district, that will be helpful to me. Commissioner Johnson, thank you for bringing this on up to date. I think this is great. I love the format. Ed, and I know this was not part of the presentation, but I was just wondering about the LEAP program and some of those successes that was not mentioned in this. Could you elaborate on that? Or
we revamped the LEAP. I don't remember if we called it LEAP Extra this year, or there was a LEAP Plus, was it?
Yeah, LEAP Plus.
And we put in some adders for heirs properties so that they could be included, as well as some other changes that gave more flexibility to people applying for these improvements to their structures, which, as we all know, really, really drives some of the disparities that exist in utility bills for folks that, have these block homes that are just seeping, energy out through, the concrete. Some of the leak program improvements have, added 25, 30% efficiency, to their system. So all of a sudden the GRU bill isn't like, oh my God, it's come, right? We can actually deal with the expenses, and they can control them more as well. So yeah, that's coming into play this year. Bill Shepard and his group, Tara Thomas, have worked, and I think they worked with you, didn't they, Commissioner?
Yeah, they did.
Simmons?
Yeah.
Yeah.
And I just think, Ed, I don't mean to cut you off, but just highlighting those significant changes, I think that should be talked about, because that does have a positive impact in ratepayers' bills.
Right.
Yeah. Thank you, Mayor.
Okay, thank you. Thank you, Mr. Blarski. Appreciate the time. I'll turn it over to the city manager now.
Thank you, mayors and commissioners. Let me share a screen to sort of give you an idea of where we are from a financial standpoint. So hopefully that is coming up, and so commissioners, this represents, if I go back to my original screen.
Yeah, I think you put it on slideshow there. It just goes by itself.
Yeah, let me fix that for a second. Okay. So, commissioners, this represents where we are on some of the major revenue sources that Commissioner Johnson asked me to take a look at. And I've put this into 5 columns. So the sales tax, which is based upon our population and the point of sales within the county, in fiscal year 19 generated a little bit above $8 million. And we didn't quite meet our goal in fiscal year 20, which we can attribute to the effect of COVID and the shutdown of the community in the March, April, May, June timeframe. But what we did as we got into the fiscal year 21 budget is we looked at what the state's projections were, and then we made lower projections for inclusion in our budget so we could be conservative. And if you look at each of these revenue sources going down, you'll see that they're lower than fiscal year 19 and lower than the state's projections, with the exception of the communication services tax. And we built our budget based upon those lower projections. Now we are just finishing the first quarter of fiscal year 21, and all these revenues receipts will lag. But what we're seeing at this from the state level anyway is that our numbers will be exceeded, which is a good thing for us. And we're moving into the fiscal year 22 budget, probably pretty strong in getting back to the fiscal year 20 numbers as we're going to be moving forward. I do want to point out also for the fiscal year 21 budget that we're in right now, as the commission is aware, we did not budget any of the savings in the general fund for the pension obligation bonds, which provided lower pension costs for our 2 pension plans. That represents about a $5.7 million push to our fund balance through the fiscal year, end of fiscal year 21, which will help our reserves. What I didn't put on this chart right now is property tax, because that's probably our biggest unknown right now. And the biggest piece of that unknown will be what's going to happen in the commercial real estate market in terms of what assessments are, since the property appraiser will be using some income factor on rents and sales that are occurring. And we just have not seen that data yet because it's has not been presented. On the residential residential market, real estate market, we see that that's continues to be strong, and we don't see that there's going to be a diminution in property tax values on the residential side, which is most of our tax base. If we go into the this next slide here, this looks at what our fund balance requirements are and where we are. If you remember back when we first started the budget process, we had looked at a 10% fund balance reserve. That was our current. The commission
Mr. Feldman,
agreed. Yes, sir.
Can you
make that bigger?
Yeah. There's a couple ways to do that, I think, but
that should be a little bit better.
This is that. Go ahead.
Okay. So our fund balance requirements now is a minimum of 16.7% and a maximum of 25. The good news is, even though we had decreased revenues in fiscal year 20, we also had decreased expenditures, and we added about another $1 million to our fund balance. Our fund balance right now sits at a little over $25 million, which represents just under 19 or just under 20%, about 19.8% of our expenditures. So we're almost double where we were from a fund balance standpoint a few years ago, maintaining a 10%, and we're well on our way to getting close to that 25%. And as the commission is aware, once we hit that 25%, then we appropriate the additional money for one-time and capital expenditures. Also, for the commission's edification, we went into this budget year still without the reimbursement for our expenditures. I'm happy to report that the county, through the CARES program, is reimbursing the city about $2.9 million, which gets us to about 75% of what our COVID expenditures were. And we will also be making a FEMA request. So while we will not get to 100%, we are getting a significant majority of our COVID expenditures reimbursed from both the federal and the state CARES program. I'm going to stop sharing my screen now. Get you back to the gallery. The commissioner also asked a little bit about resiliency, and I'll sort of approach that slightly different than Mr. Bilarski did. So when I look at resiliency, I'm looking at what the community's ability is to prepare for anticipated hazards, adapt for our changing conditions, and withstand and rapidly recover from disruptions. And clearly, COVID was not a hazard that I think any community really was prepared for on there, but I do think that we adapted pretty quick, and we were able to respond to the extent that we could in all different ways, and I know GRU did as well on there. What I think the commissioner's point was how do we recover from the effects of COVID? And the effects of COVID really were, in my mind, exacerbating some of our existing conditions: food security, health security, the ability to get employment and job creation, and all those efforts, I think, were not only hindered, but probably showed us where there were more gaps in the service than we could, than we originally intended. But community resiliency is just that. It's community resiliency, and it's our ability to work with other groups, the faith-based organizations, groups like Farm Share and Working Food, groups that are out there that can help provide the mental health assistance like Meridian and the continuum of care with our houseless community. So I think the city played a significant role both in participation and in funding some of those efforts. As the commission is also aware, we made a $30,000 contribution to both Working Food and the Human Rights Council that could meet some of the needs of our undocumented neighbors. We set up the GNV Cares for Neighbors and Business program early on, a little bit slower than we wanted to roll out, but I think we learned, as all the other agencies going out there, some of the bureaucratic hurdles we had to overcome with some of the funding alternatives. But overall, I was pretty proud of the effort that not only the city, general government made, but our other partners made in collaboration on trying to get out there first and addressing these issues. Where are we going? I think going into fiscal year 22 and beyond, fiscally, financially, we are healthy. Again, we're coming in, building our reserves up by about a little less than $6 million. And that $6 million is not a one-time phenomena, but that's $6 million a year of ongoing savings that we will be able to reprogram for fiscal year 22 into meeting some of the needs that the commission even talked about today in terms of healthcare. And I know we're going to be talking about in January on food security and so forth. All contingent, of course, on making sure that our property tax base is strong and our general fund transfer, Mr. Bilarski, continues to come in at least the same level for the foreseeable years. So that's really the picture of where we are right now. We do know that there's going to be some still shocks to the system that are going to come in terms of evictions now that the federal moratorium is coming to a close. We're still all waiting to see what role the federal government is going to play in the next round of CARES funding, and if any of that money will trickle back to us and what the intended purposes of it will be. But overall, and I think I've said this during the budget process, the fiscal condition of the city is not keeping me up at night at this point.
Okay, thank you, Mr. Feldman. You got a question here, Commissioner Ward?
Thank you, Mr. Mayor. Thank you, Mr. Feldman, for that information. There are lots of questions that I think we all have that we'll go through the budget process when we get there. But one of the things that I would point out to everyone, one of the big markers in the wake of COVID that could have the greatest impact on the municipal budget going forward, really at this point less so for fiscal 22 than fiscal 23, is what does the University of Florida do with potential furloughs? They have a policy for it now, as I understand it, but they haven't announced any furloughs. But that's the biggest employer, right? By far. If they take something like, and across the board, the workers at the University of Florida take something like a 10%, 15% furlough, that ends up impacting real estate sales, and it ends up impacting, in the long run, the value of property here. So that's the marker that we should be watching. Um, Also, clearly, it impacts sales tax, it impacts jobs in the community, but the long tail of that is that even after COVID is long gone, if there's an impact, a ding in real estate values in our community, we still have to work with that years down the road when everybody else is, when money's flowing otherwise, there's still a dip to sales tax or to property tax revenue. So keep an eye on that for many reasons. But remember that if you see that, if it happens, then there's a long tail to it in fiscal 22, fiscal 23. Unless I'm missing something there, Mr. Manager, that's what I see as the largest danger to the municipal budget that we can not predict, but have as a known unknown, as has been referred to. Thank you.
Thank you, Commissioner Johnson.
And
Sorry, go ahead.
Commissioner, if I can just address that too. So I think you're on the mark in terms of potential impact on things like sales tax. Less concerned about it in terms of the real estate market because our properties are traditionally way undervalued in terms of assessment to market. That even if there is a dip in the market, it will continue to grow by the Save Our Homes threshold, which is 3% or the rate of inflation, whichever is less per year. So we'll see less of a shock on the property tax, but we will on some of the other items like gas tax and sales tax, revenue sharing, and so forth.
Let's see. Commissioner Johnson.
Thank you, Mayor. So, like Ed, what I'm hearing from you is that we're in a healthy position. We have very little to worry about outside of our property taxes, our commercial property taxes, which is kind of an unknown. Would you say that I wrapped that up in one sentence?
Yes, I'll have a better sense in February and March about the commercial property tax space.
Okay. I'm pleased to hear from both the general manager and GRU, and the city manager about the financial health of our, kind of corporate entities of, GRU and the city. What I'm concerned about is our neighbors and our customers. I'm going to call them our neighbors, because what I've been seeing is that there's been an increase in evictions, an increase in needing emergency food assistance. And I know that we have responded to some of the needs in our community through essentially, emergency assistance in whatever way that would mean, through the CARES Act, through Working Food, and the programs that we've set up with some other entities. So while I am excited that we seem to be in a good place, what I'm hearing and seeing on the ground with relation to, our neighbors is something completely different. So I'm wondering what we feel our responsibility is and how we're going to address the needs that are forthcoming. That's a really big question, really big. And I know that we're taking it piece by piece, like having the discussion around healthcare, like the discussion that we're going to have around food, like the ongoing discussions that we're having around housing. I'd like to get an understanding from you, City Manager, what work you've been doing on the well-being index.
So, as you know, that's one of the items that's in our strategic plan to develop.
Mm-hmm.
We're looking at, we actually looked the other day at the Santa Monica model, since they tended to have a very robust well-being index. The way that we have left it with staff, and this was actually just a discussion last week, is we're going to sort of take that Santa Monica as well as some other indexes that are out there and try to just develop our own hybrid model that's going to be unique to Gainesville, so that we can measure the data points that are really specific to us. on there. Now, those data points, while they're real time, they don't change a lot either. Some of them come out annually, some of them come out monthly. So the well-being index is going to give us snapshots, but it's not going to, you're not going to see the needle move rapidly in either direction just because on the, a lot of the data sources are annual.
A lot of the data what?
Data sources are annual and have lags. So for example, the American Community Survey, which is put out by the Census Bureau, comes out once a year, and it's usually a year lag. So the data that comes out in 2020 is 2018 data. So we've just got to be careful of what you know, what the data says and what the lag is, and making sure that we understand it.
Okay. Are you going to be, what I'd hope is that we would be ready to have a more robust discussion about that in the near future, or maybe the first quarter of 2021. Do you think that's possible?
I don't want to speak for the staff at this point, but you know, we certainly can strive for that if we can get on the commission's calendar too. Your calendar is getting pretty full for long conversations, so I'll work with Omi's team, and we'll try to craft some time as close to the first quarter as we can.
That's fantastic. Thank you. There are clearly needs that are happening in our community right now, and I have questions about how the city of Gainesville can better address some of the needs, but I also am looking systemically about, you know, what does 5, 10 years down the road look like for our city? How do we set up the system so that, you know, people are receiving the health care that they need? You know, we have a food system that is not based on emergency food assistance, but, you know, making sure that our local economy is healthy through the food and the farmers. GRU, we're there. We're not quite there. We're getting there. We have a plan, but we're very well situated with GRU. You know, it's good that the priority of the commission is this well-being index, and I'd like to have a more robust discussion once the research is done, so that we can all get on the same page about how this is going to kind of roll out. And not just for the city, but city manager, is this something that I'm hoping that's to be determined. That's too big of a question right now. It's something I'd like to see for our entire county and all of our institutions buy into. So how that happens, to be determined, but I'm putting it out there.
All right, very good. Thank you. Commissioner Simmons?
Good. Commissioner Johnson asked the question I was.
Okay, very good. Commissioner Ariola?
Thank you, Mr. Mayor. Very briefly, I just wanted to say that sort of the next big effect is going to be what the state does in their session. They've got about a $5 billion shortfall. If the history of the majority of the Florida legislature is any indication, we can take some guesses as to where they're going to put that. And I can tell you it isn't going to be in raising taxes on the corporations of Florida. So watching that very carefully and how that affects our community is going to be a big impact. And I'm really not surprised to hear from both the general and the city manager. We have taken a lot of steps to be good stewards of our finances. However, the health of a government's budget is not a direct correlation to the health of the community. And we do know there's an increase in evictions. We do know there's an increase in homelessness. I've mentioned a couple times from this dais that Family Promise has seen a 300% increase in people who are anticipating homelessness. So we know that these are problems, and they're not problems that we can tackle alone. But you know, as we have been from the very beginning, from our very ambitious Gainesville Cares stimulus, you know, we're going to continue to prioritize those people. Thank you.
Thank you, Commissioner Ward.
Thank you, Mr. Mayor. Yeah, just a few things I wanted to highlight, and I'm remiss in not thanking the general manager and the city manager and the staff that works with them to make this a good thing. We have a very financially sound public utility, group of public utilities under GRU. We have a financially sound city, and that's the result of staff effort, you know, many, many hours of staff work, and this commission being focused on that as well. So why that matters, it doesn't mean anything to have a financially sound system out there if it doesn't translate into how it supports the people of the city, right? But what it means is if we're in good financial shape as a city budget and as a GRU budget, and we've got 20% almost of our annual budget available in fund balance as a cushion against bad times and emergencies, then we can serve the people that we're here to serve better. We don't have to worry about, oh my goodness, how are we going to make payroll in 2 months? We know that. It's all good. And we can consider the kinds of programs that are necessary now and have been necessary and are going to be necessary going forward. So that's, if you're watching at home, that's why we care about having we want to be good stewards of the people's money, primarily so that we can use that to make sure that we have a great place for people to live, and we're helping people have better lives in our city. And we do that to some extent now. I'd like to see us do much better in the future, and we need, to Commissioner Johnson's points, ways to measure that other than unemployment. I don't find unemployment a particularly useful measure. You know, when it gets big, yeah, things are probably getting bad. But just because people have a job to go to does not mean they have a great quality of life. So we need different measures. Nationally, we need different measures. Internationally, we need different measures for how things are going. But a measure of our ability to be helpful to the people who need it most is a fiscally responsible city. And I believe that's where we are, and I really appreciate our managers and staffs for making sure that that's the case. And I'm glad we're having this discussion. I look forward to a more detailed discussion, as Commissioner Johnson said, of some different metrics for how we can understand well-being in our community. Thank you.
Thank you, Commissioner Johnson.
Thank you, Mayor. I feel like we're on the same page about things, but I find that if things don't get into emotion, then sometimes it doesn't happen. I'm going to move that the city manager schedule that the mayor work with the city manager to schedule a meeting in the first quarter of 2021 about our community neighbor well-being index, and to update the commission about that process.
Okay, motion and a second to bring back the update on the community well-being index sometime in the first quarter next year. I guess that would be our second quarter. The one thing I think missing from this conversation is that we're seeing a significant administrative change at the federal level. We're already starting to see many of the priorities from the president-elect and vice president-elect from the cabinet positions being filled. And I'm paying particular attention to those cabinet appointments at Housing and Urban Development and Health and Human Services. I think there is an understanding, and we will certainly be working through U.S. Conference of Mayors to make sure the administration understands that many cities are not in the position to deal with these systemic problems ourselves. I think this is an administration that understands that. I think the willingness to provide local support is there. I don't know what the likelihood of getting that type of relief package through the Senate is. I have a feeling that regardless of the outcome of the Georgia elections, you're going to see half of the Senate make a very sharp turn to austerity and point to the budget deficit for a reason to not help people. So I think on one hand, we have to see what we can do within our means, which means we're going to have to be incredibly targeted. We can't be everything to all people. We don't have the capacity. So how can we use the limited resources that we have to be the most effective with the people that need it the most? And then if there are other ways specifically from the federal government that we're able to expand and leverage that, then that's great, So we're just going to learn a lot. We're going to learn a lot in the next, I think 30 to 60 days here. And maybe before that, I don't know. It's every couple of days, like talks for a relief package renew, and then it goes away. So that's becoming a little worn. But anyway, I think I'm glad we have our federal lobbyist up next, because I'd like to get some thoughts from him on what he's hearing and what local communities might be able to expect. Okay, so did any of the other charters want to weigh in here? I recognize that many of you are sort of static in your budgets and your outlook, but if you want to contribute, we'd love to hear from you.
City Auditor's Office has no comment, Mayor.
Thank you. I'm seeing no hands, and so I'll just assume if you don't throw your hand up that you're good with our understanding of the outlook right now. Okay, so Larry, let's go ahead and turn it over to any members of the public that wish to speak. We do have a motion on the floor, which is to bring back an update on the community well-being index early next year.
Yes, sir. Just one speaker on the line, Nathan Skop, and he has 3 minutes and the floor. Nathan.
Thank you, Larry. Good afternoon, Mayor, Commissioners. Nathan Skop. The comment was made during this lengthy discussion that GRU customers can't pay their GRU bills. Your neighbors can't pay their GRU bills because their GRU electric rates are excessive. GRU electric rates are excessive because of the fiscally irresponsible energy policy decisions made by the mayor and the Gainesville City Commission. GRU electric rates are also excessive because the mayor and the Gainesville City Commission refused to make a significant reduction to the general fund transfer. GRU problems exist solely because of failed policy decisions of the mayor and the Gainesville City Commission. I've been advocating for a substantial reduction of the GFT since 2011 to help reduce GRU electric rates and improve GRU credit metrics. GRU general manager has been advocating for the same since 2018. The mayor and the Gainesville City Commission, however, refused to acknowledge and accept reality. Your path here is unsustainable, commissioners. Unfortunately, your answer for every city commission created problem is creating another taxpayer funded subsidy rather than the mayor and the Gainesville City Commission changing its fiscally irresponsible behavior. Specifically, the Gainesville City Commission has an addiction to spending taxpayer money. At every meeting, you spend more and more money that you don't have and hire another consultant to tell you what to do. Gainesville City Commission has a systemic spending problem and needs to learn to be fiscally responsible. I know this is a harsh reality, commissioners, and you can virtue signal and deny it all you want, but this problem exists of your own making, and you refuse to acknowledge it. You just make excuses and say, well, we need to subsidize this. These targeted subsidies, although well-intended, are discriminatory and not equitable to the taxpayers and GRU customers that have to pay for this. So it pains me to have to tell you the obvious, but the Gainesville City Commission and the mayor, you need to own the problem. You need to help be a solution to the problem, not make excuses for the problem. And part of that solution to the problem, commissioners, is you have to cut the GFT. You have to tighten your belt on the city government expenditures and you can't keep spending money that you don't have. I mean, this is basic common sense, but you guys don't seem to grasp the plight of hardworking Gainesville families. And your answer to every problem that the city, created by the city commission is another subsidy. That's just irresponsible governance, commissioners. That's just wealth transfer. No one suggests that we shouldn't lend a helping hand to our neighbors. But, giving free internet away to people that can afford a $210,000 house, that's an unjust subsidy. They're not going to be able to have cable because they're going to be stuck with internet because Cox isn't going to roll out cable because of the failed policy decisions, because you're not thinking things through. You're just acting on your social change agenda. And you need to ring
Mayor,
that in.
that's 3 minutes.
You can't afford to do everything. Mayor Poe, you just mentioned that. You can't be everything to everyone, but you try to be.
Appreciate your comments.
Mayor, right after Mr. Scott began to speak, Nancy Darren called back in. Nancy, is this in reference to the current topic?
Yes, it is.
Okay, go ahead. You have 3 minutes.
So go for it. Okay. Yes, Nancy Darren, I fully support the motion. Having metrics that really will give us good guidance and indication is really, really important. I really thank the general manager and the city manager for their reports, and I'm just so happy and proud to be part of this community and that we have the utility we do, given not having much of a tax base, looking at not just all the values that were listed, but also to look at how powerful multiplier effects are of local ownership. And so relating back to the prior discussion, looking at doing that around public health, around food, the more that we can build local ownership, the more that we can be resilient and self-sustaining, the more we can weather the storms that are coming. I'm so tired of hearing the rates are the problem. No. Rates are a red herring. And it's not including the multiplier effect that recirculates money around and around, which is how we can have the economic stability that we have. Bills are the problem, not rates, and that is poverty, that is poor housing that we're doing all kinds of things to address. So the value of GRU and emulating that model in other areas that will be captured by different measures of well-being, I think will serve us very, very well, because as Mayor Poe said, we don't know what the feds and the state are going to provide for us, but we can multiply every dollar of value in our own community by many, many times, and we've got what it takes. So thank you all. Take care. Multiply.
Mayor and Commissioner, those are all the callers.
Go forth and multiply. Okay, thank you both for sharing your thoughts with us. That's why I love our community. We have active citizens with diametrically opposed philosophies towards the role of government and how we should advance as a community, and we get to hear them all amidst our discussion here on the commission. So God bless Gainesville, God bless America. Okay, so we do have a motion on the floor. Oh, I'm sorry, Commissioner Hayes Santos. Wasn't trying to silence you.
Thank you, Mr. Mayor. I'm very supportive of the well-being index. I was wondering if the motioner would be okay with, I know scheduling special meetings can be very difficult, to either put it on like the last meeting in GPC in the first quarter, or keeping it open to put on the GPC versus doing a special meeting. Just, you didn't? Oh, okay. All right. Never mind.
No, I think it's going to depend. We'll get an update. So, Mr. Feldman, with your good ear on, get an update at our January meeting on what the status of that is, and then we'll be able to, when we're scheduling our GPC meetings for that month, we'll know whether we can put it on one of the for that quarter, whether we can put it on one of those, or we need to have a special meeting, or whatever. I think we'll be able to figure it out then. Okay, so all in favor of the motion, say aye. Aye. All opposed? Motion passes unanimously. Thank you all for the good discussion. And our last item is a update on our federal legislative agenda. And I know that we have Harry Glenn with us. Mr. Glenn, I don't know if you've been listening to our entire meeting. I'm sure if you have, you've learned a lot about where we are as a city. But we're glad you're with us today. I'll start off by recognizing Mr. Feldman, and then we'll get into our agenda highlights. Mr. Feldman?
Thank you, Mr. Mayor, members of the commission. I was just going to introduce Harry Glenn. As you know, Harry's been representing the city for several years, and like we did with the state last month, we're going to give you a federal legislative update and seek some comments so we can formalize our direction at a future meeting.
Great. Mr. Glenn, welcome. Hope you're doing well.
I'm doing well. Thank you, Mayor, and thank you, Commissioners. Sorry I can't be there in person with you. I always enjoy my visits to Gainesville and with you all and the staff. So I look forward to the day when I can get back there and see you all in person and see, more importantly, see you when you come to Washington.
Mr. Glenn, I'm afraid it was a frigid 70 degrees today, so you probably wouldn't have enjoyed it very much. But it was sunny.
I'm actually in Clearwater today, so it's 70 degrees down here, and it's sunny and beautiful. So
huge theater.
Yeah. So anyway, so thank you all. I was going to put up a couple of slides here. If that's okay with you?
Yeah, that's fine. Thank you.
Let's see here. That's right. Oops, wrong one. Go the other one first. There we go. Can you all see those okay, Mayor?
Yes.
Okay. So just wanted to give you a quick, Mr. Harrington and Mr. Murray asked me just give you kind of a quick session. I think, Mayor, thank you for teeing this up in your closing remarks on the last item. I appreciated some of the comments and your observations on what's going on. I think you're probably spot on that nobody quite knows what's going on up there right now. As you know, there are two major issues left before this 116th Congress before they adjourn, and this has become an annual scenario where Congress runs right up to the Christmas holidays and to get their budget work done. And if you remember, a couple years ago, it was right before Christmas that we went through a more than 30-day federal government shutdown. So Congress is trying to wrap up their bills. I just saw a note while your session was going on that they hope to wrap up all their work on these spending bills by Friday in the committee and have them before the House and the Senate next week, which was good. Congress is acting today to extend a continuing funding resolution to make sure that the government doesn't shut down this year. That was the funding resolution currently scheduled to expire at midnight tomorrow. They're going to extend that another week till the 18th to give them time to finish up. So that's a good sign. To the mayor's comments earlier, the other item that they're trying to resolve and probably pair up with this appropriations package is the next COVID relief package. And I'm sure you followed the saga of this. There are currently at least 4 different versions of a COVID relief bill that are before the Congress. You will recall that the Democrats had a bill that they passed called the HEROES Act way back during the summer. And that bill made it through the House, but the Senate refused to take it up. The Senate wanted to do a smaller bill, and then they stalled out before the election. Since the election, really what broke the ground here late in the last couple of days has been a bipartisan package that 30 plus House members and senators released, about a $908 billion package that includes additional money for state and local governments. And so that was a good sign. That seemed to ramp up the discussion on another COVID bill. The Speaker of the House sent to the White House, although she hasn't shared it publicly, a version of what her version of that package would look like, supposedly in the $1.3 trillion range. Again, we don't have much in the way of detail on that. We can guess some of the things that are in there, and I'm 100% sure that state and local government funding would be in there because that's something that she's continued to advocate for. The Senate Majority Leader Mitch McConnell introduced a package around $500 billion with no state and local government funding in it. And then just yesterday, the Secretary of the Treasury sent to the Speaker and Senator McConnell a $916 billion package that does not include state and local government funding, although it could, he said. but does include checks for individuals, which none of the other three packages do. So, you know, there's a list here on the screen of the major issues that are out there. It's enhanced unemployment benefits. 3 of the four packages have those. That would be $300 a week. Payment checks to individuals, 1, possibly 2 of the packages has those. We're talking about $600 a month checks for individuals and dependent children. More funding. All the packages have funding for the Paycheck Protection Program. The Democrat package has additional funding for rental assistance. They're considering in several of the packages a continuation of the CDC eviction moratorium. And there is some discussion, although we haven't seen any packages. I know that we were talking with the general manager from GRU about some type of support for utilities. I know you had a good discussion there a few minutes ago about unpaid utility bills. So that's a potential other item in there, although again, without seeing the details, we don't know whether that is. Also, child care assistance is being discussed. Funding for schools, that would be for schools, local schools, not universities. And then finally, they need to provide more money for vaccine distribution, COVID testing, and contact tracing. All the leadership seems to say that they need to reach an agreement over the weekend on this package to get it done. You know, Mayor, you hit it on the head. I don't know whether it's going to happen or not. Everybody's hopeful, and I think most people are trying to get it done, but we'll see. I wanted to throw this up. We had a discussion with some House and Senate leadership folks yesterday to talk about specifically, because I knew questions might come up from you and the city manager about future COVID relief for local government. The bipartisan package, as I mentioned, includes $160 billion for state and local governments, $152 billion, which would be sent out to the state and local governments. The other 8 would go to tribal territories and tribal lands and territories. Just to put it in perspective, the CARES Act funding from March was $150 billion. So this would be a significant infusion of additional funds to state and local governments. It's really unclear because we've seen no legislative language for how they will distribute these funds. But of that $152 billion would go to the states, 60% would go to the states, 20% would go to cities, and 20% of that would go to counties. So that's about $30.4 billion to be divided up among the nation's counties and $30.4 billion to be divided up among the cities. And there is a bill that they refer back to called the SMART Act, which was a bipartisan bill that was introduced during the summer that tries to lay out some type of a funding formula to get this money to the states and to the local governments, based primarily on lost revenue. And I know you had a discussion about that with the city manager a few minutes ago, and also population. And most importantly, as you will recall, the CARES Act funding from last spring only went to communities and counties of larger than 500,000, population of 500,000. So only one city in all of Florida, Jacksonville, received that as a city. And then the other, I remember, I think there were 12 counties that, well, I'm sorry, 22 counties qualified. So we understand that they're trying to come up with a formula that would distribute these funds more broadly to communities. We don't know what the population threshold will be. I know the mayor has written to our legislative delegation several times on this issue, and there have been a number of letters from the National League of Cities and the Conference of Mayors and the National Association of Counties on that. One other thing I wanted to mention is that there seems to be a difference of thinking on how to distribute these funds. One of the proposals out there is to distribute the funds to the state, and then have the state get the money down to the cities and counties. Another way of thinking is to get it, like the CARES Act money went out initially, to go straight to the recipients. And I think that would be, most city and counties would prefer to get it directly rather than having to get it through the state or through a county. Importantly, too, to look at, regardless of what happens on state and local or the dollar funding that might be available, they are looking, and I think there's universal agreement on this, to extend the availability of the current CARES Act dollars that were appropriated back in March. They currently expire on December 30th of 2020, have to be expended by then. Whatever's not expended by then goes back to the Treasury. They would extend that deadline to December 30th of next year, 2021. So I know you've received some funding, and the city manager mentioned it earlier from the county that's been helpful to you. This would be important because then the county would have more time to expend any money they might still have in reserve, as well as the state. And so the last item is really more for the states about providing guardrails for pension liabilities. So that's the current state of play on where we are with current legislation and with COVID relief. I guess the mayor asked me to pontificate a little bit about what the outlook would be on a bill. I still think they'll get there. I'm not 100% sure whether COVID relief for local government will be in there or not. That is, the Senate Republicans don't want to do that. The House Democrats insist on it. And so how that plays out is yet to be determined. I think could be determined in some part by the president of the White House. Just wanted to switch a little bit just for our political science lesson here. You know, we had the elections on November 3rd. Just wanted to give you a quick snapshot. The mayor mentioned the Georgia special election. We'll talk about that in a second. On the House side, as you know, Republicans picked up several seats in the House. The way it looks right now, the current count is that when the 117th Congress convenes on January 3rd, there'll be 222 Democrats in the House and 211 Republicans. There are, believe it or not, still 2 seats that races remain uncalled. In both races, there is less than a 20-vote difference between the 2 candidates. But in both races, Republicans currently lead, and they were previously Democrat seats. Republicans picked up 12 Democrat seats in this election cycle. The Democrats picked up 3 open Republican seats. So that netted out to a gain of 9 Republicans in this Congress. As you know, there'll be 5 new Florida House members, including your Congresswoman. Your new Congresswoman will be Kat Kamick, who I think you know. She knows the city well and is looking forward to working with you. I've talked to her a couple times about some of your issues, including the Job Corps situation. There'll be 61 new House members. It's pretty good size crowd. And the interesting thing here is for Mayor and you all that are elected officials, the Speaker of the House will only have a 4-vote margin for close votes in the House. As you know, 218 is the magic number for majority vote in the House. They're at 222, so they'll only be able to lose 4 of their members in order to pass any legislation going forward. Complicating that factor is, and the mayor mentioned too, some of the appointees that the president-elect is rolling out. 2 of those, Cedric Richmond from Louisiana and Marcia Fudge from Ohio, who parenthetically will be the new Secretary of Housing and Urban Development. She's a really good member, a staunch member of the Congressional Black Caucus. When they leave their seats in January, vacate their seats, that'll take the Democrat count in House down to 220 votes until they can have special elections in both those races, which could take anywhere from 3 to 6 months. So it'll be an interesting first several months of the new Congress. On the Senate side, Republicans, as you probably all know, control the Senate after the election 50 to 48, with 7 new senators coming in. 2 senators, both in Georgia, both Republicans, are in a runoff election on January 5th. You'll be happy to know that the ballots go out in the mail on Monday and voting begins already for the next election. No idea what's going to happen there, but the important thing is if the Republicans win both, the Republicans will retain control of the Senate 52 to 48. If they split, Republicans will retain control 51-49. But if the Democrats win both seats, it'll be a 50-50 Senate for the second time in 60 years. And the new vice president-elect will be the tiebreaker and would give control of the Senate and the legislative schedule there to the Democrats, and President Biden will have an all-Democrat government. So as the mayor indicated, that'll really determine the outlook for legislation in the next Congress. Just real quickly, I also mentioned that the president-elect continues to roll out his senior staff positions and recommendations for cabinet members. I figured you all would ask what we see happening in the first 100 days. It seems like new presidents are always measured on their first 100 days in office. He talks about additional COVID relief, whether or not they get another bill this month. He's pledged to do more in the way of COVID relief going forward. Of interest to the city would be his second priority is doing an infrastructure type stimulus funding bill, much along the lines of what President Obama did in the 2009 and 10 time frame with the Stimulus Act he did. And then the third thing he's looking to do is to review and roll back regulations and executive orders that were implemented by the current administration. A number of those, and we'll have to continue to monitor those. Could have an impact on some city operations regulations. I know I talked to Mr. Murray at length about fair housing, and one of the regulations he's looking to roll back here is on fair housing regulations that the Obama administration had put out and that the Trump administration rolled back. So it'll be a busy first 3 months for the new president. Long term, in talking to his transition staff, we know he's got to focus on climate change. We just had a good discussion, or you all had a good discussion on resiliency and on mitigation programs. You also had the first segment of your discussion today was about healthcare and economic disparities. That's a secondary focus for this administration, is how to address those, particularly since they've been exacerbated by the COVID pandemic. And then finally, they want to review and take action on the Affordable Care Act. You know, there's a Supreme Court decision will probably roll out in the spring or potentially June that could have a significant impact on the future of the Affordable Care Act. And the president-elect has said he wants to take action to fix pieces of the Affordable Care Act, to address some of the things I think that Commissioner Simmons and others were talking about earlier. Just real quick, some key dates coming up. December 14th is the day that the electors meet in their state capitals to cast their votes for the president. January 3rd is a Sunday, the swearing in of the 117th Congress. January 4th is the Georgia special election, be an interesting time. January 6th, the Congress convenes in a joint session, the House and the Senate actually count the electoral votes. And then on January 20th, will be the inauguration of President-elect Biden. It'll be probably an in-person ceremony, but not of the 1 million to 2 million that you typically see on the mall, much more smaller crowd. He's actually talking about having a more ceremonial inauguration event on the 4th of July on the mall. So be an interesting time there. And I wanted to, I guess I switched off that, and Mayor, can you still see this?
Yeah, we can. Yes.
Great. If it's okay, I'll just go through this and maybe just take the questions all at one time. Is that okay, Mr. Mayor?
That'd be great.
Okay. So I think you all have a copy of this. Worked with Mr. Harrington and Mr. Murray on this list of the federal legislative priorities, and I'll go through those. I know you've had a long day, so I'll go through them relatively quickly, and then maybe we could talk about answer any questions you have or talk about any specific issues. I already mentioned, I think, expanding COVID relief is something that's of interest to the city. Certainly it's of interest to all the cities in the country. The mayor did a really good job throughout the past few months of communicating with your delegation, congressional delegation, the 2 senators and your House member, about the need to provide COVID relief for cities smaller than 500,000. So cities like Gainesville would get some benefit from that. A second issue we've been talking to the city about and the city manager about is trying to look at FEMA public assistance funding. He mentioned earlier in his comments that you all would be submitting money to request to FEMA for reimbursement for some public assistance expenses related to the COVID. You know, the FEMA has continued to sort of shift the guidelines for what's eligible for reimbursement and not. And so one of the things that we're trying to track for you all, and I know the associations you're part of are working on this too, is to make sure that FEMA is fair in the way they're providing reimbursement for public assistance. They can't keep changing the rules. It's difficult for the city to make good budget decisions when they don't know what's eligible for reimbursement. And also to look at ways in which FEMA can assist communities in general with reimbursement for other natural disasters that come. We have perennial hurricane and tropical storm problems, and we have situations where FEMA is slow in paying out. We've had several communities in Florida that are 3 to 4 years behind schedule and getting paid out from FEMA. And in some cases, FEMA comes back and tries to recoup money from communities after they've already been reimbursed. And so, we will continue to work on those. I think Congress is aware of that and has tried to make some progress with FEMA, and we'll work with the new FEMA administrator to make sure that he's aware of particular problems in Florida. A second area of interest to the city is building a sustainable infrastructure. That goes to some degree to some FEMA and HUD programs that provide for federal disaster preparation, resiliency, and mitigation. And we've been talking to your staff about some potential. There's a new program called the FEMA BRIC program that's eligible communities are eligible to apply to try and solve some of your resiliency problems, whether it's from climate or flooding or other environmental situations. It's a program that was created by Congress in 2018, funded at about $500 million a year. And it's a lengthy application process, but a good one. And we've talked to Mr. Harrington and Mr. Murray about some things that you might be able to look at for the city there going forward. One of the biggest items that Congress will address in the first year of the new Congress will be the reauthorization of the FAST Act, which is a program that funds all of the federal highway and transit programs, including the RTS. Congress was supposed to get that done. The current law expired on September 30th, but Congress being Congress extended the deadline for another year, so they have till next September 30th to finish up on that. But that's really important to RTS. This includes funding for the Federal Transit Administration to fund things like your low-no bus program, expanding your bicycle and pedestrian facilities and trails, and other safety improvements. I see on your county's future agenda looking at Vision Zero, which is to try, I think, and help with pedestrian and bicycle safety and those issues. So there'll be programs and opportunities there. And as I mentioned earlier, one of the Biden administration's goals will be to do an infrastructure bill that probably would include this reenactment of this legislation, but also expanding it to look at other areas that they can assist communities like yours. Also on sustainable infrastructure is the issue of broadband. We've talked extensively with you commissioners, many of you individually about this, but also with the GRU. Gainesville has not traditionally qualified for any funding, broadband funding from the federal government because it is mainly focused on rural communities. But for the first time in the last few months, members of Congress are realizing that there's a broadband problem in urban areas and cities, large and small. And it was exacerbated by the COVID when students and people had to stay at home to work and they didn't have the broadband they needed to do that. So there may be very well part of an infrastructure bill, a focus on broadband support to communities like you and to the GRU to try and connect more parts of the community, your community, the east side of your community with broadband services. I know you have impressive goals as to become an energy-free, independent community, and the Biden administration is really focused on including in infrastructure programs that will support carbon neutral and renewable energy sources for individuals, businesses, and communities. And so we will continue to work with your community on that and watch for funding opportunities. And also looking at the potential for water infrastructure. There was a major water bill that Congress worked on this year. And unfortunately, in the last week before it went through the House and Senate, they jettisoned off all of the clean water and water infrastructure programs that were initially part of that bill. So those will be brought back in January and February to work on. And there could be some opportunities there to look at things like septic tanks and other issues that would be of interest to the community. And also, Congress is really focusing in now on zero waste efforts and recycling, finding that communities are really having a difficult time with doing the right thing to recycle, but having a difficult time of figuring out where to send that recycled material to. So Congress is looking at that. Several bills, bipartisan bills, were introduced in the last Congress to create federal programs to support recycling efforts, and we will continue to look at those. And then talking about clean water, one of the issues we've talked to the GRU about is Congress on a bipartisan basis has been looking at this issue called PFAS. It's a chemical substance that finds its way into the water from many manufacturing processes. Most notably, it comes into the water from the foam that firefighters use at airports to put off jet fuel fires. That gets into the water, and it's a cancer-causing component. But it could also have a significant problem to the GRU in that the cleaning up of that is very difficult and expensive, and it could be, potentially, depending how Congress legislates on that and EPA makes decisions, could become an unfunded mandate for the GRU. And so we're continuing to work on that to make sure that government does the right thing when it comes to PFAS, but that they don't turn it into a tremendous funding problem for your utilities. And then I know the community in Gainesville is one of the only communities in the country that received a grant from the National Science Foundation in the past year to work on smart infrastructure and technologies to take advantage of technology in making the community a better place to live and work, and for transportation in particular. And so there will be some additional opportunities coming down the pike to do things related to technology. I know we've worked on your autonomous bus project and try and find ways to help the city develop some of these, because I know that you're a progressive community that wants to do that. And I think there will be some opportunities in the infrastructure bill. On the subject of creating more job opportunities, I know one of the biggest areas that we've been working the last couple of years, and going back to the mayor's visit 3 years ago, and Commissioner Ward's visit 2 years ago, and then the city manager's visit this past year, is the future of the Job Corps site. I was speaking to Senator Rubio's office today and told him that the city really appreciated that he's gone to bat for the city to try and get the Department of Labor to be more responsive to the city's questions about the future of the site. I know you've done some tours out there, and the Department of Labor is getting close to it's initiating a process with the General Services Administration where they will put that piece of property up on the General Services list of surplus properties. That our goal would be that the city could claim that property, and I know you have some discussions going on about how to make best use of that property. So we'll continue to work with you on that. It's a bit of a process, but one I think that Congress has been trying to encourage GSA to streamline, and try and get these properties off the federal books and onto and off to the communities, so they're not just vacant properties, that they can be made use of better. And related to that, and I know that all the visits we've had over the last 3 years at the Department of Labor, we've talked about trying to find ways to provide new job training opportunities, federal job training opportunities, and programs for the Gainesville area to respond to your local job training needs. Now that Job Corps is gone and those slots have gone elsewhere in the state and the region, there still is a job training need there. We had a very good meeting with the city manager and commissioner in March with the Department of Labor. I think the new Department of Labor will be more engaged with what you're trying to do there, try and create creative job training partnerships for the community. And so we look forward to working with you on that. I've seen some names today being circulated for the new Secretary of Labor, although the Biden administration hasn't released any names yet. And then finally, on this category, I know several of the commissioners have talked about the Opportunity Zone, and I know that the staff has been tasked with coming up with a program to take advantage of this federal tax incentive program that was created in the 2017 tax bill to encourage development into the city. I don't honestly know what the future of the Opportunity Zone program will be. It was created by it was a bipartisan program, but mainly led by Republicans, including the administration. Some Democrats don't think the program has provided the benefits as advertised, and so there's some conversation about scaling back the program or even potentially eliminating it. That's a discussion for the new Congress, and we will watch that closely. Conversely, there's also a discussion underway about expanding the program and trying to make it more responsive to communities, and even expanding the number of census tracts that would be eligible for Opportunity Zone funding. So those are issues that we will continue to look on. I know that you have a good Opportunity Zone tract in the city that would be good for development. We have seen other parts of the country where investors have come in and used this Opportunity Zone tax incentive to do some good projects. I think Jacksonville has been a good example of that. Orlando's been a good example of that. And so I think there are opportunities, and they may have been slowed during the last few months because of the COVID, but once the economy reopens, there should be some opportunities there. And then last two items, addressing affordable housing, I know is a large priority for all of the commissioners. I know that you're having some robust discussions with the county about the future of homeless programs and who's going to manage the homeless population in the area. And then public health and food security. You had a really good discussion earlier today on healthcare disparities and also the need for better food options. So we'll continue to look at those programs, talk to Mr. Murray about some of the homelessness issues, and and some of the decisions that you all are going to make and what the implication is for future federal funding that the city might need to serve the homeless population. I've had some discussions with the fire department about the community resource paramedicine program. There may be some federal funding opportunities there. I know there may be a potential need for some equipment to support that program, and we've talked about potential funding sources for that. And then talking about secure funding to improve access, justice, sustainability in the local food system. We had a really good discussion a couple months ago with the University of Florida about some of the things that they're doing and some potential partnerships there with the university to provide better and more creative ways to deliver higher quality and more nutritious food for the community and help in some of those areas. So, and we had some of the commissioners come up. We've done some meetings in Washington about that and look forward to working with you on that. And then finally, related to public safety, is to continue to look for funding opportunities for your community. As you know, the events of the past year, there's been a real focus on police reform, and there was federal legislation introduced, passed through the House. There was a Senate version of the bill that did not get through the Senate, but that's an issue that the Biden administration wants to continue to look at, is how does the federal government continue to partner with communities on policing programs, trying to provide alternative programs that respond to the needs, the mental health needs, and to prevent violence in the communities. And then there would continue to look for funding sources for your police department and fire department through the Department of Justice, and FEMA has a variety of programs that we'll continue to work on. So that's kind of a summary of the I think the federal agenda that's before you all. A couple other things I just wanted to mention to you is that one of the funding opportunities that may become available, and we've talked to the city manager and to Mr. Harrington and Mr. Murray about, is Congress is very seriously considering bringing back the process called congressional earmark spending. Much like your state legislature, you can make requests to the state for specific funding for projects. Congress did that for many years, but suspended that program in 2010. But the new chairman of the House Appropriations Committee, newly elected chairman, and the Senate or the House Majority Leader are talking seriously about trying to bring back earmark spending, which would be the ability for you to work with your congressional delegation to ask for funding for specific projects without having to go through a competitive process. So there will maybe some opportunities for that. We will work with your staff to identify some projects to potentially have available if that becomes an option, to help with some areas that you've talked about earlier today, possibly. The other thing I would say is, I know I've always enjoyed having your visits to see the congressional delegation and the agencies in Washington. Unfortunately, I think what we know from Washington and from the Capitol Hill is we're probably going to be in a virtual environment when it comes to federal meetings for some time, at least the next 3 to 6 months. So we'll have to continue to do our work with them virtually and figure out how to connect you with your new congresswoman and the senators and their staff and some of the federal agencies by Zoom and Teams and whatever other platforms we're using. But unfortunately, I think the federal buildings will still be closed to visitors for at least a couple of months till we can get through this vaccination process. So with that, I think probably best, just Mayor, if I could open it up to questions and answer anything that you all may have.
Yeah, thank you very much. Always hearing, I appreciate hearing the sort of perspective from inside the Beltway, even though you're down in Clearwater. We're glad that you're there. But really appreciate the thorough review, Harry. And yeah, we do have a couple questions, so stick around. Commissioner Santos.
Thank you, Mr. Mayor. I saw that the House passed a decriminalization of cannabis last week. And do you see the Senate taking that up at all, or is that just going to kind of sit there and go away?
No, I saw a speech by Senator McConnell the day after it passed the House. He said, no, we're not bringing it up. So the answer is, in the short term, is no, don't think so. There are two issues that may get split out of that discussion and may come up in the new Congress. One is related to banking when it comes to cannabis products. You know, because it's still on the books as a controlled substance. most of that business is done in cash and can't be done through the banks. And so there was actually a bill passed by the House, and thought we had a good shot at getting it through the Senate to change the banking rules to allow the cannabis industry to use banks. But that bill stalled out in the end. But I think the sponsors are talking about trying to bring it back next year. The second issue is related to marijuana research. Right now, there's only one source of marijuana plants that can be used for any research in the country that comes out of Mississippi. And that's been really difficult for universities and other institutions that want to do research related to marijuana and health impact of marijuana and the health benefits of marijuana. So there is a bill there that was included in the marijuana bill you're talking about, passed the House, that would change the laws related to the use of marijuana for research programs. And so that I think also has a good chance of passing in the new Congress. So I think there's still some opportunities. I don't know that they're going to get to the legalization unless, and I guess I would caveat that by saying it depends a little bit on what happens in Georgia. You know, if the Democrats win both those seats and the Democrats control the Senate agenda, then they have the ability to control the House and the Senate legislative agenda, and things like this could very well get done. So stay tuned to January 5th, I guess.
Thank you. One other thing I believe the commission should support and goes towards our affordable housing goals is support of the Biden housing plan. There's a variety of different things in there, and that's one of the areas that I would like for us to push and support. And then thirdly, you spoke of the infrastructure project maybe being similar to what Obama had passed as stimulus back in when he was president. And if memory serves correct, it was kind of geared towards shovel-ready projects. And do you believe that the new infrastructure project will be geared towards shovel-ready projects?
You know, it's interesting. We were actually on a call yesterday with some of the transition folks from the Biden program. They have a new phrase for that now. Instead of shovel-ready, their phrase is shovel-worthy. That's how they're calling it. So I think what they found with that program is that projects were advertised. Sometimes projects are advertised as shovel ready and they weren't. Sometimes projects they thought were shovel ready, but because it's a federal project, you have to go through some additional hoops and it just takes longer. And so they were not able to get constructed. And I think the other issue, and it goes to what the city manager was talking about earlier, this financial situation of cities is maybe 5 years ago, 4 years ago, even 2 years ago, communities had more money to provide whatever the match might be for these programs, whether it's 15 or 20% or 40% or whatever the federal match might end up being in a bill like that. The communities right now with the COVID don't have that match available to them, and also may not have that match available for a couple of years. So if you want to do a stimulus program and build infrastructure, you're going to have to do it without local match. And so, and that goes to the state match too. It's just going to be difficult for the state to match these. So I think they may roll back the idea of having things that have to put a shovel down tomorrow as a condition of funding. But I do think they are looking for projects. I think shovel-worthy is actually a pretty good term. I think they're looking for projects that aren't just notional, they're actually moving forward. And one of the things the current administration did is try to expedite the release of dollars through the federal process. Organizations, communities qualified for money, receive money, they won money through competitive programs, then it takes them 3 years to get the money from the federal government. And that's just, that slows down the shovel worthiness of projects. So I think they will look for projects that are ready to go, but they understand that it's going to be a little more difficult in the current environment.
All right, thank you. My last question. We have a new Congresswoman. I was wondering, has she laid out any kind of policy goals that might affect us at the local level? Or not really yet?
She hasn't, although I have talked to her a couple times. I actually have a call with her next week. She served the current congressman for his entire term in office, so she knows the communities. She spent most of her time in Florida, worked for him in Florida as opposed to Washington, so she's been on the ground there. She knows the community, and she has told me that she's anxious and wants to be more engaged with you all as a community and to be helpful to you. And so I don't know what her agenda is. I don't know. She doesn't have her committee assignments yet. They won't know those till January, so we don't know what committees she'll serve on. But I do think that having been a staff person myself in Congress, I think the fact that she served in the district all these years, she knows you well. I think she'll want to engage and be very proactive with the community and try to be helpful and task her with some of the things you're trying to work on. So, and the other thing I will say is from the political standpoint, people sometimes think that freshman members of Congress are freshmen, so it takes them a few years to build up any seniority and any ability to help. I find it just the opposite. I think freshman members have a real opportunity to be helpful from the first day out because they have a small agenda, they're looking for things to do, they want to be impactful, and I think their leadership, and whether you're a Republican or Democrat, their leadership wants to be helpful to them to make sure they're successful. And so I think working with a first-term Congresswoman will actually be good for the city because she's going to be energized and willing to create an agenda that includes you.
Thank you, Mr. Mayor.
Thank you. Commissioner Simmons.
Mayor. Hi, Harry.
Hello.
I have a question. Because of COVID, do you see, or has it been anything in the pipeline or something that may be coming to look at the health disparities in our most vulnerable communities? I know we have the paramedic program that we're looking at, but if anything else come up regarding COVID-related healthcare issues, will you definitely keep us in the loop on those type of opportunities?
Yeah, you know, the president-elect throughout the campaign has, or at least for the last few months of the campaign, had regular briefings. He had his own COVID advisory task force that were working with him throughout the months leading up to the election. Then after the election, he's continued to meet with them. He's created a health transition team. But one of the things, Commissioner, that I was really heartened by, there's a woman named Marcella Nunez-Smith, Dr. Smith. She's an MD at the Yale College, and she is coming to work for the administration, and her focus will be on healthcare disparities, initially related to the COVID, how they can address that, but she also has been tasked with looking at healthcare disparities in general and how to address those issues and what the federal government can do to help communities. That's why I listened to your discussion this afternoon about that. And so I think there's some opportunities there. I think the program that you're working on in Gainesville, the paramedic program, is a great program. I heard conversation about the first mile, last mile service for people who need to get to their doctor or their medical appointments. If they can't get to the medical appointments, we actually had the local transit agency down here in Pinellas County actually partnered with a hospital in Tarpon Springs, Florida, on a small pilot project where the hospital actually paid the Uber and Lyft service to and from the doctor's offices and the hospital because they found that patients couldn't get to their doctor's appointments and their appointments. They were missing the appointments. They made them unhealthier, but it also cost the hospital money because then the doctor and the staff were sitting there with appointments that were being met. And so they actually found it was more cost effective for them to pay the transportation to get the patients to their appointments. And it's actually been a great partnership. So I think some of the creative things you're trying to do there is something we ought to take to Dr. Nunez-Smith with the administration and raise some of those issues with them. And that may be a good project to talk to your Congresswoman-elect about. I think she'd be very interested in this one.
Thank you, Harry.
Okay, thank you. Thank you, Mr. Glenn. I really appreciate it. I'm just going to make one request of you. If you could try to arrange a meeting between myself and Congresswoman-elect Kamak between now and when she goes back for swearing in, I'd appreciate it. We could do it somewhere safely socially distanced if she's willing to do that, or we could just get on the old Zuma room and do it that way. But I'd love to have a conversation with her since we're about to adopt this and sort of share that with her personally as we kick off. The other thing is I'd be very supportive of adding support for the Biden housing plan to this agenda. It's very largely based on Cory Booker's housing plan, which is exceptional. And I think it dovetails with a lot of the work we're trying to do here as well. So with that, I'll go back to Commissioner Santos.
Mr. Mayor, I would move that we adopt the 2021 federal legislative priorities and that we also add on that we support the Biden housing plan.
Okay, a motion and a second. Second was Commissioner Ward. By the way, Madam Clerk, on the last item, the motion was made by Commissioner Thompson, seconded by Ward. I don't know if that was clear before. Commissioner Ariola.
Yes, thank you, Mr. Mayor. If we could add to the motion also support for federal climate action more in the vein of the Green New Deal, I would appreciate that.
Okay, seconder, okay. So adds support for federal climate action. Okay, so we'll get those added, Harry, and then you'll have a final agenda that you can have in your hip pocket. And again, we'll have that conversation with Congresswoman-elect, hopefully, before she heads back to Washington. All right, so with that, we'll turn it over to Larry. Any members of the public wish to speak on the motion?
No, sir, not on the federal agenda. No, sir.
Okay, then back to the commission. All in favor say aye.
Aye.
All opposed? That motion passes unanimously. Thank you so much, Mr. Glenn. Stay safe out there. We appreciate all of your work on behalf of our neighbors up there in DC.
Sure, I wish you all the best for the holidays too. Thank you.
All right. I think our next item was member comment. Was there any member comment? Okay. Oh, Commissioner Simmons, go ahead.
Thank you, Mayor. I just wanted to thank my fellow commissioners for the vote today. Appreciate it.
Okay, thank you. I wanted to wish all of our Jewish neighbors a happy first day of Hanukkah. And I think there will be a safe menorah lighting ceremony 4 days from now, I think it is. Sunday, is that it? Sunday or Sunday night? Okay, yeah. Down at Bo Diddley Plaza, which is always a really nice event and family friendly, but we'll make sure everyone is wearing a mask and socially distant. So come out and enjoy that. And we do have a joint meeting with the County Commission, which will be our last official meeting of the year next week with some important items on that. So feel free to join us for that one as well. It'll be a little bit different. The City Commission will be in our chambers here. The County Commission will be in their chambers over there. We'll be hosting the meeting, and so all of our sort of social distancing and public comment rules will apply for both sides. We'll be running the public comment and everything. So that's the process that people are used to. And with that, we have no further business before us. This meeting is adjourned. Thank you, everybody.